So hello, everyone. It's an amazing point that we're at this point. A lot of preparation's gone into the program so far. And so for me, it feels like a little bit of a milestone here. We really begin to launch the concrete activities in the ZonMw COVID program. My name is Eric Schultes, and I'm International Science Coordinator at the GoFair International Support and Coordination Office. Just so you know, I'm an American living and working in the Netherlands for about 10 years now. A biologist by training, a research scientist for many years, and just over time migrated more and more into the fair data stewardship space. And so it's a real pleasure to be on this project, for one, and to be able to introduce you to the idea of Metadata for Machine Workshops #2. Before we go further, I don't know if Margreet would like to just also have an opening remark here at the top.
Yes, thank you, Eric. Welcome to you, everybody who is taking place in this training for data stewards. Just as Eric said, I'm also very excited that this workshop is taking place. It's a marathon training for data stewards, and in this way, I think almost 50 data stewards in the Netherlands will get ready to help the researchers who are working in the ZonMw COVID-19 projects. And we put all this effort for this program because actually for all science it's very important, but for COVID it's even more urgent that we now really take fair data seriously. And Eric, GoFair and Cdr and Helverai and many others have worked very hard this summer to put all the concepts together into a very practical approach to train data stewards and to let researchers together with the data stewards work on this. In the training, the focus will be on metadata. Well, in the context of the 3-point verification framework, as Eric will explain you. But we consider metadata, machine-readable metadata, as a crucial starting point for reusable data and getting access to data and the information on the databases and the research. Very much more than we have available until now. So this crucial step will be made with you as data stewards together today. So I think that is the milestone that Eric also mentioned. And I wish you good luck and a lot of fun with this training. Before we continue, I want to acknowledge in this, so Eric Schultes of GoFair, John Graybiel of Cdr, Jeroen Belian of Helverai, who will help to make the metadata available on the data portal. Meg Jette, who is the great supporter for all researchers and data stewards with the data stewardship interest group. And last but not least, Rita Azevedo of Helverai, who coordinates the whole project. Okay, Eric, for you, the rest of the floor.
Yeah, thank you, Margreet. And very nice that you acknowledged the team up front. I have a slide as well, but you know, it's what you see right now is just sort of the tip of a big iceberg down below. So I'm going to just mention that the slides that I'm presenting now are available at this link. It's at on a platform called the Open Science Framework. And I think they should be freely available there. If you just click on them, you should be able to download them. Because there will be a lot of links embedded in my slides that may be useful to you going forward. And here's the agenda today. You know, we sent this out yesterday. Oh yeah, and just at the top of the agenda there, I'm indicating that this presentation for today and tomorrow, the workshop, is recorded. So just so long as you are aware of that and are consenting to that. Yeah, and so the agenda is, it's a 2-day workshop. We're getting used to the Zoom capabilities for this nowadays. And uh, we have this brief introduction now, a welcome moment, and then until about 3:30, so for about 90 minutes or so, I want to be able to recap and give you an overview of this very unusual funding program at ZonMw called the COVID program, and this attempt to really advance this 3-point verification framework. So just kind of, this is something that you saw already in the information session, but I think it's nice to start it as a baseline again. And then we start going a little bit deeper into this idea of metadata and metadata for machines. And so this necessitates some introduction to the FAIR principles. So we'll spend a little bit of time on that and the FAIR data point, which is a key component here. And once all that's in place, then I think the idea of the Metadata for Machine Workshop and how we're going to try to organize it in the program will be pretty straightforward. We'll take a break around 3:30 for questions and answers, and at some point when we're ready, we can get some coffee. And then at 4 o'clock, we will be joined by a colleague of mine, John Graybiel. He's a technical lead on the Cdr platform and another resource called BioPortal, which I think many of you must be familiar with. And John is an expert at Cdr. He helped to build the platform, but he's also a great teacher. And what we're going to try and do in the 2 hours today, and then maybe in about 3 or 3.5 hours tomorrow, is give you kind of a whirlwind introduction to this platform, Cdr. It's a metadata authoring platform. It was initiated, I think, as a project about 5 years ago. So right around the time FAIR was becoming, formulated as an acronym, as a simple acronym. And I think the Cdr platform is a shining example of technology that is lifting us a long way forward to machine actionability and to FAIR data and services. So it's a great platform. It's not the only way to do metadata, and it's certainly not the only way to run a metadata for machine workshop, but I think it's kind of a classic way to do it. And I think the skills that we can impart in the next 2 days will not only pay off in the context of the COVID program, but they should also really be something that carries with you throughout your career. More and more organizations like ZonMw and other funders are going to be requiring higher levels of fairness, and having skills like those that you have with the Cdr platform can be a huge asset in helping to make your stuff more fair. So tomorrow, so we end at 6 o'clock today. The funny time frames here is a function of the fact that John is in Stanford, which is about 9 hours behind us. So I think John is working out like he's going to do this meeting for us now very early in his morning, and he's going to do it very late for us in his evening tomorrow. So that's why at 8 o'clock in the morning tomorrow, we will reconvene and continue with the very practical Cdr training. And then, we come to a point somewhere around 11 o'clock where we can do questions again, take a breather. But I want to reserve the last half hour then for formulating in a more precise way how we can proceed in the month of October and November in terms of booting up our approach to the metadata for machine workshops, and then what these workshops will actually look like in November. So that's the agenda, and I copied it out for myself so I can keep time on things. It's useful. And so a few preliminary housekeeping things, organizational things. We have a common notes document at this bit.ly, so I can put that into the Zoom chat. And this is an open document, so it is there for everyone to see. So just so you're aware of that. But please feel free to keep notes and also your questions there. Mayaka and Rita will be moderating your questions to me in the presentation. So if you have questions or comments, leave them in that document. It's also collective notes. So any other links or interesting things you want to put in there, go for it. This is a link to the OSF project space where you can find yeah, my slides, which I can give you the link for that as well. And these are the slides for John for today, for starting at 4 o'clock. Back here. And these are my slides. Okay. And then lastly, there's a Slack channel. Many of you are probably already on this. I'll put that link in here. This is going to be a communication platform for all of us on this call going forward. And if you have any questions, if you're not getting to the right spot, you can email Micah about that. And one of the last things here, John asked me, please, if you can, go ahead and open up an account on Cdr before 2 o'clock, and that will save you some time when John starts his presentation on Cdr. And then it's kind of fun to say, you know, who's on this call. You know, it's too big for us to do a personal round of introductions, but maybe it's enough to say that unbelievably, we've got 49 data stewards who've dedicated their time and energy to this workshop. So these are what we would call, you know, COVID program data stewards and PIs. And I don't have a breakdown as to of these 49 people between data stewards and PIs, but or project leads. But that's what we have from the COVID program. We also opened up this presentation to observers, and there's almost as many observers as there are participants. And I wanted to highlight not only that we have people from different countries here, but we have a large number of people from Africa on the call. And these are my colleagues from a project called Vote on Africa, which I will explain to you. And it's highly relevant to the COVID program because Vote on Africa is already setting up fair data points, and they've already run their own Metadata for Machine Workshop. So I think we can keep our eye on the Africans as a way to, you know, to see where we might be headed in the COVID program. Just a note on the observers, however, you know, we mentioned in the registration, there's some house rules. If you are an observer, and so it means you're not really in the COVID program, we're going to ask you to refrain from questions and interactions, at least in this presentation. We want to really reserve the time and the focus for the participants of the COVID program. So this is their workshop, their resource, but we're really happy and we really welcome the observers in any case. If the observers have any questions or want to know more or need more links, you can always come back to me for that. And then let's talk about your COVID program support team. So today on the call, it's me from GoFair, and it's my colleague John Graybiel from Stanford. But here's the other team that Margrethe has already mentioned some of these people. So from Health RI, we have Micah and Rita, who, like I said, will be handling today the questions and kind of moderating the session. My colleague Jeroen is one of the technical guys in the program. He has a background in medical informatics and is, I'll be working quite closely with him on the Metadata for Machine Workshops going forward. And then Tineke and Sophie are also going to be assisting in kind of the other aspects of the program after the Metadata for Machine Workshops, which is helping to set up a portal environment for all the data. And then at GoFair, we pulled in a number of really great colleagues who are very technical, and they will be assisting in the creation of some metadata components that we will, I'm sure we will use in the rest of the COVID program. And there will be some development around the fair data point. So this is our technical crew, and they will be available as well later on for consulting and helping. And then Masha at the GoFair office and Jacinta at the GoFair office and foundation are helping with the support in the background. And then I also wanted to mention, we have the Data Stewards Interest Group, which has become a real force of nature in the Netherlands for data stewardship. And they have capacity as well to assist in how we develop going forward. And kind of just rounding out then with this introduction, this is a slide that I copied from the information session we had. And I don't know what it looks like from your end as a data steward if this process so far has been like overwhelmingly complex and you're trying to track where it goes. I just want you to understand that working very hard in the background to try and keep it simple and to try and keep it focused for you. And we're gonna continue to try and guide this process, which is really developing, which takes me to my next slide. Those of you on this call are not at all guinea pigs or test animals on this. The Metadata for Machine Workshop, the Fair Data Point, the 3-point verification framework, all of these things are not yet off-the-shelf products that are highly polished and ready to go. These are things that are still in development. And rather than being guinea pigs, I would say that you should consider yourself really a co-developer in this process. What happens in the next year on this program is going to advance this whole technology and this whole methodology in big leaps. And so there will be new methods, new components built. If you're interested in this research element or this development part, if you are interested in publications on some low-hanging fruit out there, this is a real opportunity for you as a data steward. And I just want to emphasize that. The fact that we're still at this very cutting edge, the downside is that, yeah, there's a lot of question marks and we don't have all the answers all the time. The positive side is that you really get to help develop something that I think will have a pretty lasting impact. So I've mentioned that we're building an airplane while we fly it, and a lot of people involved on these projects, they echo this back to me all the time, that this really makes sense to them, that the answers are not all there, but they're being built. Okay, so that's the intro, and I hope that was all pretty clear. I want to just take a few minutes. This won't take long, but it's just a recap of what we talked about in the information session a couple weeks ago. And this is really all about fair data stewardship in support of the National COVID Health Portal. That's the ultimate objective, is to set up a health portal for the Netherlands that's driven by fair data. But to do that, we have to understand better how it is we create this fair data. And therein lies some elements of tooling and technology, but also other elements of training and awareness of what all this entails. The ZonMw COVID program, I want to emphasize, is really something that's incredibly innovative. This has never been done before. And I think it, to the degree that this works out for all of us, it could be really seen as a model in other funders, other countries that are taking a look at this. There's two things that make it special. And the one is that the research outputs in this program are required to be adherent to the FAIR principles. And in fact, it goes a little bit further. It says not only should things be fair, but your data and your outputs should be on a fair data point. That's a particular implementation of FAIR. And the good news here is that that technology is something that we can support you with, and it gives us a plan on how to do this. The other thing is that the researchers in this project have discretion over some of the elements of the verification process and how they want to achieve this fairness. And so they actually have budget for this. That's the innovative thing I wanted to point out. But the ZonMw is also providing for the support that you're getting, like, for example, in this workshop and continuing further. So there's an awareness at ZonMw that FAIR is something that they want, and it's not trivial to get there. So it needs to be well funded and mandated. So that means that we're all entering into a pretty unusual situation. This has never been done before. And again, I think we're all in this together, and hopefully we can really push the whole concept of this further in the next couple of years. And then as a reminder, why are we here? And it's all because of this pandemic that we're undergoing, which is just a little over 6 months old at this point. And this pandemic has created the mandate, the urgency, the funding to begin a new level of fairness in research outputs. And again, that's this urgency is what brings us here, for example, in this webinar. And I'm just pointing out the timeline for the COVID pandemic. Early on, before many of us even heard of COVID, at GoFair, we were already getting requests from organizations that had something to offer as far as FAIR and COVID data related resources. So these groups eventually formed an implementation network in GoFair called the Virus Outbreak Data Network, or VODON. And then over the next 6 months, from then until now, it's been very rapid development, both at ZonMw to launch an entirely new program like this, but also in GoFair to be able to work with, for example, our African colleagues to set up FAIR data points in Africa. We recently crossed a 1 million death threshold in the pandemic, and I think the urgency behind this is more than ever. This is just a snapshot of the implementation network at GoFair, and I'd like to point out that what we're doing today and in the COVID program is really inspired by 2 projects that were initiated back in March, right when the VODON network emerged. And it was funded by the Phillips Foundation and then also another project by ZonMw. And this was to set up FAIR data points, in the first case in Uganda, but then maybe other African countries, and then also at the LUMC. And what we've seen in this time period then, is an unfolding of that process. It involved all the components of this 3-point verification process, but it's only in hindsight that we've been able to kind of consolidate it now in a way that we want to present it to you. And again, you remember this from the information session. Our typical research trajectory takes a researcher into the funding world. If they get awarded some funding, they generate a project and they create some data and hopefully some publications. That data could involve many different elements, maybe some patient related, others just sort of laboratory related. But in any case, that data is not typically FAIR the way it's produced. It's stored somewhere, but it's not something that's easily connected to the other data elements coming out of the project, oftentimes not even connected to the research articles, and that data will eventually go lost. So in the COVID program, there was this idea that we could actually adhere to the FAIR principles, and that has taken the shape now, due to these projects from Phillips Foundation and ZonMw, into this 3-point verification framework. And we're borrowing from VODON some methods, like, for example, the FAIR data point. And by saying that we borrow the methods, we're borrowing the FAIR implementation profile, or the FIP of VODON. They figured out how they wanted to implement FAIR, and we are going to a large degree, replicate what they've done. But we can do this in a very precise way because their FAIR implementation profile is itself a pretty technical document. So we will borrow this idea of FAIR data points ourselves, and that's good, but those FAIR data points only work when they are loaded with appropriate, enriched, machine actionable metadata. So that's why we must come eventually to create this metadata for ourselves. And we can at least kickstart that process through these metadata for machine workshops. And the idea then is once your data is on that fair data point, it can connect to other data assets. It could connect to the fair data point at the Leiden University Medical Center. It could connect to the fair data points, now 6 or 7, I think, in Africa. And it could also connect to the, to the other fair data points that are emerging within the COVID program. And another way of looking at this, at least for the Netherlands, is that these fair data points themselves can be interconnected. It can be bundled in pretty arbitrary ways, but the end result would be something that actually mimics kind of a centralized data repository and allows for some pretty semantically rich search and access capabilities by virtue of the way the fair data points are built. So that's the idea. We will populate the program with a large number of fair data points, which can later on be bundled up and presented to the world as a portal. And that would allow all the researchers within or outside the program to be able to access the research products. Let's pause for a moment. If Rita, Micah, are there any questions at this point? Are there any comments?
No, there are no questions yet. There were some people with difficulties with logging on to Cdr, but it's an advice to check your spam folder.
Yeah, yeah, kind of check the typical things. But if there's any problems, we will resolve that when John gets in.
Yeah, so if you have questions, please ask them either now directly to Eric or in the shared notes document or in the chat.
I can confirm that all University Medical Center email addresses, it will directly go to the junk email because it's an unregistered address.
Yes.
So I was the guinea pig and I found my junk.
Yeah. Sometimes that's the case with the medical centers.
It happened with me as well.
Jeroen, what's the workaround for that then? Is there can you go into some security settings and adjust it?
No. As long as people are aware of the fact that it goes directly to the junk and they don't delete their junk, they can find it. So and the other thing is, if you have a Google address, you can use your private address. But if you prefer to use your work address, that's fine. And also GitHub, there are links to either provide your own, let's say, work account, either Google, and then you can authenticate using your appropriate means. And the same holds for GitHub.
Got it. Super. Okay, well, thanks for trying, everybody. That's good to know. So here's then the real content that I wanted to mention for today, and it's a little bit of an introduction to FAIR and the FAIR principles, and I'll try and show how that relates to a FAIR data point. I'll give you a feeling for what a FAIR data point is, and then I think that will motivate, the metadata and our approach to it in the program. So, and then by the way, the value of Cdr should be more evident than when John hops on at 4 o'clock. So we've already mentioned there's this 3-point verification. We've referenced it, I think, enough to you, so I'm sure you've seen it by now. Just to let you know, there's a working group that meets, I think, every other Friday at this location. And you're welcome to join, but you're not, I would say that you're not really obliged to, or you're, use your discretion here. I don't want to, we're all busy, so I know you can't all be on every working group all the time, but I just wanted to make you aware that there is a working group that's developing eventually, I think, some of the technology here, but to start off, we're really just trying to develop documentation behind these 3 elements and how they're connected. And it's just a heads up again that for those of you who are interested, once you get into this process, if you want to contribute to documentation and making training materials or making resources available, this is highly welcome. It's really a co-development project. So I'd like to welcome you in on that. And then I'm also going to highlight, there's another link here to 3-point verification events that are happening throughout October and November. So it's a busy time for many of us because the COVID program has really put a lot of momentum into this, and now it's really getting really active. So the Metadata for Machine workshops that we do are some of these events, but we also have other events related to the FAIR implementation going on right now and other things. So you can take a look at the document and just be aware if you would like, you could join those other events as observers as well. Okay, so let's talk about the FAIR principles. This is how they looked back in 2016 when they were originally published. And they were published in as a commentary. So not even as a scientific research paper, but it was a commentary in Nature Scientific Data. And since then, for whatever reason, they've been wildly cited. So I think it's something like 3 or 4 citations per day are coming in on this paper. Yeah, okay. I hear someone in the background. If you can mute that. The FAIR principles themselves in this research article, there was nothing much mentioned about them. It was only this figure item, box 2. And if you look closely, they're very like computer science oriented, or let's say data science oriented in how they look. But these are principles that better and better automate the F, A, I, and R for both data and services. So really kind of any kind of digital object or service could be rendered increasingly fair by following. And the first thing I want to say about them, because I'll take you through some of these so you can get a better feeling for them. But the first thing that's nice to point out is that metadata is everywhere. And it's pretty safe to say that you're not going to have fair data if you don't have fair machine actionable metadata behind it. So in some ways, the metadata is a high priority here. Before you can even think about publishing your data in a fair way, you're going to have to think about how to construct your metadata. And if we look then, if we go down the list here, in principle F1, there's a request for globally unique and persistent identifiers. And this is just to say that any of your data records will be invisible to the computer unless they have some kind of unique identifier pointing to them. And even more, we'd like to say, globally unique, persistent, and resolvable identifier. So eventually the computer can resolve to the actual meaning of what it's looking at. F2 and R principles, I think, are what we would classically consider metadata. So it's metadata for findability, and it's metadata for example, for the detailed provenance of your research. So the real scientific metadata would be like R1.2, but there's also usage licenses, and there's this interest in FAIR to adhere to your domain relevant community standards. So these are, I think, classic, a classic picture of metadata is what these principles are asking for. But again, they should be rendered machine actionable. And that's where maybe things get a little tricky. If we go a little further, F3 is a principle that seems a little bit oversimplified. It's just that metadata clearly link to the data that it describes. It seems pretty simple, but it almost never happens at the level where a machine that's looking at the metadata would actually know how to link to the data itself. For humans, we can often do that very easily. If we go to a landing page of a research article, we see a lot of links, maybe even advertisements, but we can always click to the PDF of the research paper itself. These things are not always clear for the machine. And so F3 is trying to make that explicit. And I would even say more and more, I see F3, maybe along with F1, as the heart and soul of FAIR. If your metadata can describe and tell the machine how to get to the data itself, then I think you've achieved one of the hardest things in FAIR. And the FAIR data point, by the way, you could think of it as a tool that does exactly F3. It does other things, but it's really designed for this F3. F4 is basically saying things should be indexed somehow and searchable. And there's lots of search engines that are out there. Some of them, like Google, might come in and do it for free. But Google is explicitly not fair in that it doesn't allow for API searches or for machine actionable searches. Bing, by the way, the Microsoft Bing, as I understand it, does do this. And so in that way is a little bit more fair than we would say Google is in that case. But this is to say that we have to think, how are we going to conduct our search? What's the search engine? What's the search capability? So all of that was for findability. The accessibility is asking, A1.1 and is really just saying that the protocols to access the data have to be open and freely available. For the vast majority of us, the World Wide Web protocols, which we use every day when we are on the internet, on the browser, when we send, when we do a lot of clicking on the websites, this is all perfectly acceptable as an access mechanism, but so is FTP and other protocols for transferring data. Principle A1.2 is important because it acknowledges that not all data can be open. Certainly not patient data, certainly not private, personal patient data. So the FAIR principles were designed to say, your data assets should be machine actionable, but it doesn't mean necessarily that they must be open. You can also have very private, sensitive data be perfectly fair, so long as there are the proper authorization and authentication protocols put there, and that the machine that visits that data would know exactly what it needs to do to get that authorization and how to authenticate. So, it was I think wise of the authors of the FAIR principles to realize that a lot of important data won't be open, but we can still make sure that mechanisms can be in place that the machine can still figure out how to access them under well-defined conditions. Principle A2 is, again, this is really an emphasis on metadata. And I think the FAIR principles have done a great job to elevate this idea of metadata to be a first-class citizen along with the data itself. And maybe I mentioned before, but in some regards, the metadata is even more important than the data itself from the point of view of FAIR. And I say that because the Principle A2 is asking that your metadata persist even if your data should have to go missing because it's scheduled for deletion or because it just disappears by accident. It's nice to have the metadata record as a more permanent, almost a kind of publication talking about your data. And this is important because under those conditions, you can then set up what are called like tombstone metadata elements that could say, oh, here's data that, this data used to be here, it's no longer here, it disappeared on such and such a date. And at least that would help people who are searching for these assets to understand that data might just not be available anymore. Lastly, the I principles are the hardest. This is, the idea here is that the way these three principles are written, they're asking for controlled vocabularies, even ontologies, that you structure your data into conceptual models and you make them semantically enabled so that the computer can more and more actually navigate through the content, the scientific meaning of the data itself. This is an art form in an early stage of development. It's some of you may be already quite conversant in semantic technology. Our metadata needs to be machine actionable. That's just a requirement. So this is the reason why we have the Metadata for Machine Workshop. It's to assist the researcher, the data steward, in overcoming these difficulties of the I principle. And the Cdr platform is this incredibly powerful tool where the data modeling and the semantic machinery can be built, but then represented to the user as a simple web form. And the user can then fill out this form like they would any form on their browser, but the information is captured in a machine actionable way and can be put onto a fair data point so that it then becomes available as fair data.
Eric, we have
Yeah.
2 questions now. We have one question about metadata.
Yeah.
So maybe I give the floor to Jessica first. Do you want to ask your question yourself, Jessica?
Sure. It was just regarding the accessible A1.2.
Yeah.
Because the idea, as I understand it, is to try and have this sort of mechanized, having the machine have the authorization set up. When I think about like how things are right now, when access is restricted, everything's done manually. Somebody sends, like there might be an element of automation where someone sends a request and that goes, but then it's still a person providing access. So I just thinking about like how this would work, like how does the machine get authorized?
Indeed. Yeah, great question. And the answer here is indeed A1.2 gets pretty sophisticated if you want to think of it in a fully automated system. And that's not to say that there aren't some pretty serious projects out there that are attempting to address this issue in a very general technology way. If you've heard about the Personal Health Train initiative, and there's versions of this in the Netherlands and in Germany. It's also called distributed learning, but it's the idea that you have data stations out there, something like a fair data point, where algorithms can move between these stations and knock on the door, do the authorization that's required to access the data that's there. And this is a negotiation between machine agents for access to data at different levels of protection. That's still very much bleeding edge development and is not something we can deploy today in the COVID program. So a perfectly acceptable solution here, a perfectly great solution actually, is that we could build into the metadata, hey, here's some important data, but it's pretty sensitive. If you're interested, then please contact this person. And here's a telephone number, or a Skype account, or contact this office at the hospital. We can give specific contact information to the authorities that are entrusted with the protection of that data. And at this point, it's perfectly acceptable to have the metadata offer up that more human level contact.
Thank you.
Also say something? Via the portal, we would like to have a way of already linking the data sets to a request portal that would more or less help you make the process a little bit easier. There will always be manual intervention at some point in the process for this kind of data, essentially that privacy sensitive data, but we are going to try to make it the process as easy as possible, whilst the cutting edge technologies like the Personal Health Train are not absolutely available yet.
And what's really nice about the request portal is that it begins to offer us in the COVID program a more standardized way of handling this. So it's not like the data stewards at every hospital or research environment have to then create this solution for themselves again and again. We can avoid the reinvention of the wheel and get a little bit more standardized efficiency out of it.
Great, thank you.
Yeah.
Eric, we had another question. It was about FDPs. It was asked a little bit earlier. I hope I pronounced your name correct. João, could you?
João.
João. Could you ask that question yourself, if that's all right?
I will read the question from João. He's not feeling, he's got some health issues. So regarding the FAIR data point installations, are all deployed in on-premise environments, for example, in hospital data centers, or also in commercial cloud infrastructures like Azure and others? If on both, did you experience any privacy and security issues?
So it's early days, so we don't have a lot of experience yet, but in fact, I think we have deployments both locally and in cloud environments. I think it's too early yet to say what the performance looks like, or how that affects kind of security issues to be explored in the COVID program. I think the FAIR data point is really this application that you can download. Anyone can launch it. I'll explain that in a minute. For me, it's always been a big question, I don't know how to answer this. How will the community choose to deploy FAIR data points? Because really, individual laboratories could have their own FAIR data point, perfectly fine. It's likely, I think, that hospitals will have their own FAIR data point, or maybe a small number of hospital-wide FAIR data points. Maybe university association or hospital associations like the NFU could have their own FAIR data point. I don't know how the community would like to do this, and that will be another thing that emerges over the next year or two, is how best to deploy a FAIR data point given the kinds of data on it and the kinds of security and the maintenance that you would need on it. So that's another open question that we will resolve, I think, as we go forward. Speaking of the FAIR data point, let's talk about that. Here's the FAIR principles again, but this time I color-coded them by principles that more or less refer to technical infrastructure type things. So, for example, we wouldn't expect the biologist in the COVID program to create new identifier schemas necessarily, or new identifier resolution systems. We wouldn't expect the biologist to figure out complex authorization procedures, etc. The blue principles, however, are metadata elements that in most cases can only be answered by the biologist or the domain expert who's working on this. So the FAIR principles gives us this kind of, this interesting challenge here. We live in a world that's not yet fair. So we don't really have all the technical infrastructure fitted together to make FAIR run smoothly. But that technical stuff is the red principles, and that's the domain of technical people. The blue principles are the responsibilities of the domain experts. And I think the data steward is a kind of interface between this red and blue area. If I start talking about implementations of the principles, then we could say that the FAIR data point is already beginning to address some of these red principles, some of the technical elements. And the Metadata for Machine workshops are trying to assist the domain expert in creating the blue elements. So let's talk about the FAIR data point, just so you have a better feeling. It's a real thing. It's getting more real all the time. And what it is basically, it's a server application. So it's something that runs on the server, and you can visit this. And I would say the simplest thing to say about it, it's a metadata publication platform. This is a platform for publishing your metadata and making it available to the world for query. The data that this metadata points to, and I'm showing that down below here, might reside on that same server, or it could reside anywhere. It could reside at commercial publishers. It could reside at highly secure data repositories. But the FAIR data point allows for the metadata to be queried and accessed And if the machine should want the data itself, then the fair data point will redirect that. That's that F3 principle. And the fair data point works through these ordinary, called these World Wide Web protocols. And the fair data point follows a controlled vocabulary called DCAT, the Data Catalog Vocabulary, which is a nice W3C standard. So it's a nice standard to follow. And what we're going to do is augment this very simple DCAT vocabulary with more enriched metadata for our research PIs. So the DCAT is just this 3 layers of metadata. It says, okay, I have this fair data point. Within the fair data point, there's one or many data catalogs. And within a data catalog, there's maybe one or many data sets. And within a data set, there's something called a distribution. And that's sort of just the media type, or also the mechanism by which you will actually access that data. So what I'm showing here is an example in data set 1. There's a version of it that's text, and there's another version of it that's in this RDF machine actionable format. So it's the same data, but in 2 different distributions. But it's all the same data set. There's another data set in this catalog that looks like a CSV file. Maybe it's an Excel spreadsheet. There's another catalog that's pointing to what looks like image files. And these distributions are describing the file formats for those image files. So what we envision then is maybe through some kind of query mechanism, and there's a query language called Sparkle that you might be familiar with. The computer can drill down through these layers of metadata, always moving forward when it finds what it's looking for, and eventually gets down to the data itself. If your data was actually machine actionable, if you had a data model behind it and a semantic model behind it, the computer could actually go to a row, to a column of your data set, and it would find a number, and it would know that that number is a blood pressure reading of a patient in a hospital at a certain date and time, connected to the drug regimen or therapy for that patient, the pathologies. All this information would be available to the computer by virtue of it being rendered in this semantic format. But in any case, even if that semantic data was not there, and we had to rely on only the patient records written by a physician, that's okay. We could still access that, and the human would then have to interpret that themselves. So long as this metadata is here, you've gone a long way towards fairness. And by the way, the access restrictions, the authorization, authentication would be somewhere on these arrows pointing down. Right? There would be metadata describing who has access and under what conditions. The fair data point is a real thing. Here's just some information. These are specs for the fair data point and some references. The fair data point has been deployed by my colleagues in Vote on Africa. I mentioned this before. And this is an example of a fair data point at Kampala International University in Uganda. And this is a web client that exposes the metadata of the fair data point for the human, but below this human interface is machine actionable data and metadata below it. So here's the top level, the fair data point. There's a title and a description. On the right, you see a bunch of metadata, right? This is in English. There's a time and a date. There's some keywords. Within this fair data point, there's catalogs. In fact, there's 2 catalogs in this case. And if I look at the migrant media report catalog, what I'm going to find are data sets, and just one data set in this case. And that data set happens to be, if I go to the distribution, I found out that that data set's a Google document, and that Google document contains information from newspapers and news media on migration patterns due to COVID. So if I click on that distribution, I actually get the access link. And in this case, it's a pretty simple call just to the Google document itself, and I can take a look at the document. The document is not particularly machine actionable. It's just text. The machine can't really navigate that, but the human can, and the human can at least find it in this case. if you go to home.fairdatapoint.org, I'll put that in the chat for you, you can see an index of the FAIR data point that we have at GoFair DTL that's running in many of these African instances. These FAIR data points, when they launch, will automatically call home and begin to register themselves. And this would be a starting point for a search engine to go out and index all that machine actionable metadata on these FAIR data points to offer it up for search later on. Oops, yeah, here we go. Yeah, and just here's a timeline. Vote on Africa launched their FAIR data point, the first one, in July. The LUMC launched their FAIR data point on on August 31st. But then there was another meeting between the African colleagues and the Dutch colleagues. And then on October 1, we had the first case where we placed a federated Sparkle query over FAIR data points located in Leiden, but then also in 2 regions in Africa. So incrementally, we're getting to a point where we're starting to see the emergence of FAIR data points, COVID related, by the way, right? It's all funded under COVID programs, and are becoming actionable. If you want your own FAIR data point, you can go to a Docker Hub and download it. There are other options for FAIR data points, but we will describe more of what that looks like later, not now, but there will be a time when everybody will be interested, I'm sure, in getting a FAIR data point, and you will have options on that. Here's another view of the FAIR data point, and this is where we get into metadata now. Here's the 4 layers of the data catalog vocabulary, and what you see in each layer are a few metadata records, or up to maybe 10 metadata records. These are just sort of one-line questions. What's the language? Is there a license? What's your description, title, etc.? And this constitutes kind of the core metadata of the FAIR data point. And that's kind of comes for free. You launch the FAIR data point. There's a web client that will ask you to fill in the blanks. So that's pretty straightforward for anybody individually to do. But we will want to do this in a more collective way in the COVID program. And we will want to begin to decide on a standard way of launching these FAIR data points and making sure that they adhere to a COVID program spec, so that we know that these FAIR data points are coming from this program. And we can even figure out ways maybe later on to figure out if, how secure are they, and whether or not we can even conceive of some kind of certification for these FAIR data points. This is something that's being asked for by pharmaceutical companies, for example. So again, and I'm just showing here at the bottom of the figure, there's specific links in the distribution records to the data sets, and those data sets could be highly distributed. But we can already begin to map the FAIR principles onto this very minimal metadata. We're already asking for licenses in the FAIR data point. So by launching a FAIR data point and just filling in these blanks, you're beginning to get more and more fair in the way you're representing your data. These classic metadata things, these findability metadata and provenance related metadata are also here, but in a very minimal format. And what we want to do going forward is be able to design more, I would say, scientifically relevant and specific metadata components that we can extend the FAIR data point with. And one way to do that is using Cdr. And that's the whole point behind getting some introductory training to Cdr, and then seeing if within the COVID program, we can begin to build up a kind of knowledge and expertise on, say, Cdr and the way Cdr works, and maybe some other approaches to augment the FAIR data point with increasingly more scientifically relevant data. That's the mission.
Erik?
Yeah.
Before we go on, we have another question from Jessica, who can't talk at the moment either. So is there a definition or general guidance on what a catalog should be?
Well, yeah, so you can go to, can I get this? Yeah, I can do it. So here's a technical spec for the data catalog. And this is what, very high level computer scientists would say. The answer to the question though is, in fact, I think we're free to do whatever it is we would like to do in augmenting or in using these components for our purposes. The only obligation we have is that we describe in a very rich semantic way what's going on so that the machine can follow what's there. So I think it's a decision that we have to make collectively in the COVID program. Yeah, how do we want to label our FAIR data points, and how do we want them to work? What belongs in a catalog, and how do we describe catalogs? This can be a great subject for the Metadata for Machine Workshop meetings, for example. And the real mission here is to get, if we can, I think the ultimate goal is to get a COVID program specification on these types of questions. If we cannot, as an entire group, because we're a pretty diverse group, we have 50 research projects here, if it's impossible for us to really come to a complete 100% consensus on these specifications, it's perfectly fine that we could branch out into multiple implementation profiles, because there's very exact ways of talking about that as well. So it's not really a necessity, but it would be awfully nice to achieve a kind of COVID program FAIR implementation profile where all these agreements can be very clearly specified. Anything else?
No, Jessica says awesome.
Okay, great. So finally, that brings us to this idea of a Metadata for Machine Workshop. And I will give just kind of an overview of it here. There's documentation emerging on this. And for me, I'm looking very much to the month of October, where we're gonna dot a bunch of I's and cross a bunch of T's. And then I think we have kind of the next generation format for these workshops and some tooling behind it that we can all take into the Metadata for Machine Workshops in November. So, and I'll explain that in a minute. But yeah, this is again to mention, why M4Ms? Well, metadata is everywhere. And the purpose here is we want to be able to assist the domain expert, or let's say the data producer, who has some kind of mandate for FAIR resources. We want to assist them in creating the machine actionable metadata that can satisfy and adhere to the FAIR principles. This idea of running a kind of workshop environment where this can happen, really a kind of hackathon environment where you pull in the domain researcher, you pull in a data steward or a FAIR metadata expert, and through a kind of dialogue or negotiation, they can come to an agreement on, this is the essential metadata I need, and here's how best to represent it. These might be the vocabularies and the ontologies that we choose to represent it. It might be other aspects of framing the schema. Maybe it's largely reusing components that have already been built before, but maybe the domain researcher doesn't have a deep knowledge of metadata. So we rely on the metadata expert to kind of guide us in this decision process to get the best high quality FAIR data out of it. So we ran the first Metadata for Machine Workshop, which was much more of a kind of a seminar at that point. It was really just kind of scoping this. But this is just about exactly 2 years ago. We did it in October of 2018. And since then, we've ran a series now of workshops. We just finished, September 30, we finished Metadata for Machine Workshops 5 and 6. And this was, again, me and John Graybiel from Cdr working with 2 groups in Denmark. One is a climate-related group, climate data-related group, and the other was, if you can believe it, weather data streams collected on wind turbines. It turns out there's a lot of money in the wind turbine world, and even small changes in weather patterns can translate into important consequences. So that data, there's a real incentive for that data to be fair as well. So this is to say that we're learning more and more about what's involved in creating fair metadata, number one, not that we have all the answers. And number two, we're learning how to better assist the domain researcher to get as fast as possible to their fair data. And that's the mission. It's really to try and make this as painless and as rapid a process for the domain researcher. And so this is just to recap the slides, right, that we saw in the information session. Domain expert, metadata expert, what comes out are these fair metadata schema designed in consultation with the domain expert. So we know that they're relevant. Whether or not they're beautiful and elegant from a computational point of view, we know they're relevant to the domain researcher. This could be a data steward, right? We can call that a data steward. And the way the program is being designed now, we're thinking, okay, we have these 50 projects. There's a project lead that could be the domain expert. We can bundle the projects into 5 or 6 cluster areas and run a metadata for machine workshop for each cluster. I don't think it's just not going to be practical at the moment to run 50 individual metadata for machine workshops. And yeah, we've scheduled, or let's say we reserved dates where these workshops can be run. And we've asked the biologists out there, where do you belong? And I think we've completed that phase where I think we've clustered now all the domain researchers into their clusters. And now I think we're starting this phase here where we say, okay, let's go to the data stewards and let's give them some background on FAIR and some background on metadata and maybe even some training with Cdr, so some real practical tooling. And let's see if we can ask our data stewards to then help to guide and facilitate these metadata for machine workshops on behalf of these researchers. So that's a pretty accelerated learning curve. I understand that. But we're here to support and guide you along the way. But the idea is what we're training now is not, what we're doing is not just trying to solve a problem for the COVID program. We're also trying to boot up a capacity throughout the Netherlands for people who can start helping to deliver fair metadata in any research domain for any research project. So what we do here, again, is designed to be a kind of lasting contribution. It could be, for example, that ZonMw will come back to you data stewards who have gone through this first phase and ask you to create metadata for cystic fibrosis research projects or for cancer-related research projects. And the good news here is that once you have done this for, say, COVID, altering your approach for another disease area is probably going to involve, it will certainly involve some new ontologies and some new methodologies, but for a large part, the metadata in COVID will carry over, the generic components will carry over to the cancer research. So this is the hardest moment now. It's really learning how to do all these things from scratch, but more and more we'll be able to just kind of replicate this for different disease areas. So are you ready for this process? And then eventually we want to get this metadata onto the fair data point. And yeah, we're doing pretty good on time, I think. So, in the time we have today, I can't go very much into the idea.
Maybe just one there was a question by Renata about what an overview of the clusters, including the different projects. Maybe I can answer that.
Yeah, absolutely.
So we're still mapping the clusters to the dates and the projects. It's become a quite complicated task to do it. We hope to finish it this week. But I think something that we also need to add here is that we decided to add an 12th cluster there, right?
Yes.
For socioeconomics and behavioral projects. Oh yeah, it's already there. Okay, sorry. Yeah, we do not have the overview of the mapping of projects versus the clusters yet, Renate.
Yeah. And I think the way this could turn out, we kind of assigned numbers here now to these clusters. I think it could very well be that in time, in the time coordinate, metadata for Machine Workshop number 7 may come after metadata for Machine Workshop number 9, for example. I think we'll probably stick to these numbers because they're kind of there now, but we'll figure out the best time frame to run those workshops. Yeah, any other questions?
Not at the moment.
Okay. So yeah, given the time frames, you know, we really want to reserve most of the time for John in this workshop. So we won't go into a lot of detail today or tomorrow on how these workshops will look for us. If you want to know more, you can go to a draft handbook for metadata for machine workshops. This is kind of like a dry book or a way of kind of helping to formulate the goals and objectives and methods behind these workshops. You can get to them at this link. I'll put that in there as a bit.ly. I hope that works for you. It's a new link. And you know, what will certainly happen in the course of the next 8 weeks is that we are going to learn much more about how to do this. And this handbook will become even better, you know, placed as a document to assist people in running these workshops in the future. So again, it's a call to you, the data stewards, if you would like to be contributing to this handbook, if you'd like to help edit it or write it, you know, that opportunity is there. But if you go to the link, you can find out, you know, a little bit more detail about how we've envisioned this. And, you know, at some point too, I will try to summarize the experience from our metadata for machine workshops for the Danish group. We learned a lot there, and we'll try and get that to a point where we can share it as well. But here's the overview of what we're trying to do. I'm coming back to this diagram of the FAIR principles. And again, the red principles are these more technical elements, these more infrastructure related elements. And what we're doing in the COVID program is we're going to rely on the FAIR data point to secure most of the red principles for us. That's what it was designed to do, and that's how we can use it. So it should be viewed as, you know, the FAIR data point is just some infrastructure. And one day in the future, you know, all these FAIR infrastructures will just kind of be embedded in our software and in our networks, and we can more and more forget about how to do FAIR. It'll be kind of built into our tooling. But until we reach that point, we unfortunately do have to be doing this in a more manual kind of way. And so it requires us to be a little bit more aware of these things. The blue components I mentioned were these domain relevant components, these domain specific components. And so certainly we want to begin looking at, well, how do we answer these questions, or how do we formulate metadata for these blue areas that are consistent with COVID research? And maybe we also might consider, you know, that we want our data to be as widely reused as possible. So we don't want to just take a controlled terminology that was developed in a local organization. We would like to look at ontologies that maybe are more global in their formulation and that are more widely used, so that if we were to build our data with those ontologies, we could be guaranteed of more interoperation down the road. This is to say, you know, there's a lot of considerations that go into crafting this metadata. But what we can also do is break it down into kind of like these 9 categories. If we can, in the course of the COVID program, come up with solutions for these 9 elements, then we should be pretty darn fair in the result. And this is going to be our approach in October, and is to work with the Cdr tool to begin formulating some more, I would say, robust and standardized solutions to these things. We've been doing this all along, but this is an opportunity for us to take the next step. And again, the data stewards on the call here have an opportunity to really make a contribution. Some of these metadata elements are pretty simple. And I think once created, they kind of will be widely reused. The handbook goes into a little bit more detail about what these 9 components are. And I think we're doing not too bad on time, but I don't want to spend too much time on this. But let's say, for example, number 2 and number 8, category 2 and 8, as I say, these are kind of like classic metadata that we would think of for findability and for the scientifically rich provenance areas. What we, I think we'll do, I think what we're deciding on in the technical group for this is we have a very generic metadata template that can describe data sets. And this was formulated in Metadata for Machine Workshop number 6 back in Denmark just a few weeks ago. And I think we're going to try and repurpose that very generic metadata template for data sets for use in the COVID program. And what's handy about this, right, is that the FAIR data point has catalog, and in the catalog there's data sets. So I think this metadata component we have from our previous workshop is going to fit very nicely into the COVID program, but it will require that the domain experts speak up on the appropriate ontologies that are needed and the data standards that they prefer, and that this can be built into then the metadata descriptions for that data set. And likewise, there's some other components here in, you know, if you look at the FAIR principle and you try to see what's being asked for, we can almost certainly begin to create Cdr templates, Cdr metadata templates for these things, if we know how to work with Cdr. And once we create these templates, they can be reused over and over and over again for every data set that's created in the COVID program. So this could become a new standard for the COVID program. Let me give you an example of how this might actually work. In Metadata for Machine Workshop number 2, we worked with an organization called preclinicaltrials.eu. And this group, this community, is focused on animal subject research. And the idea is, you know, because animals are difficult to work with and the experiments are always complicated, the preclinicaltrials.eu wanted a registration form of your research project before you even collected data. So it's a pre-registration of your research project. And this was to try and understand how it is that a research project is proposed at the beginning and then how it ends up changing over the course of an animal experiment at the end. And if you click on this link, this registration form, you end up with this web form, I think 32 questions, and it's just kind of basic metadata about your research project. I think I can blow this up. You know, it's just asking for really basic metadata, right? So general information, the title of the study, the acronyms, the contact details, your name, your role, your email address. These are all basic metadata. You can think of them that way. But this community wanted to collect this information, but the way Preclinical Trials was doing this was not particularly fair. They were just collecting this information as free text, storing it as a PDF, and yeah, there's a large number of documents that people could read, but very difficult for the machine to process. So what we did in Metadata for Machine Workshop number 2 is we had people from Preclinical Trials work with the Cdr platform, with John Graybiel again, to create a Cdr template for the form. And what you can see is the Cdr template is title of the study, acronym, your name, your role, your email address, etc. So what this is it looks very much like a web form, like the other one did, but the information captured in the Cdr template is now embedded in machine actionable, as a machine actionable metadata. And that template itself can be stored in a repository and made available for reuse to others. And by the way, this form is a perfectly good example of an R1.2 metadata. It's provenance metadata on your research project. And this community says it's important to have. It turns out that the COVID research program also would like to have pre-registration of your research projects. We could repurpose the metadata template from preclinical trials to the COVID program, modify it for our own purposes, and again, that modified template becomes available for others to reuse. So I think this is an example, from Metadata for Machine Workshop number 2 and Metadata for Machine Workshop number 6, which we just finished last week. We're already beginning to see we accumulate metadata templates that can be widely reused in the next round of research projects and Metadata for Machine Workshops. And you will learn today how to construct these Cdr templates. And 2 more slides to show. We've been able to kind of formulate that, like how do we then, realistically train people in Cdr? How do we realistically compose some Cdr templates to augment the FAIR data point? There's a bunch of questions here. And the way this is, I think, going to be working out, it's actually going to be a very intense 8 weeks coming up in October and November. And what we see is that we have in October, what I'll call the staging phase, is where we kind of set up what we need for the metadata for machine workshops in November. So we have these cluster groups. We've been busy partitioning our researchers and data stewards into those cluster groups. And what the COVID program support team, so Jeroen, John Graybiel, Nicola, Barbara, Christina, Diva, and myself, we can work to create these metadata components, to begin laying out these templates for the FAIR data point. But we would very much like to do that engaged with the data stewards that are on the line today. And we will figure out a way to do that in October. I'll show you in the next slide a starting point for that. But we would already like to begin to engage the data stewards and work with you to start composing these metadata components that you would then take into the Metadata for Machine Workshops in November. And this is a prototype right now of what that agenda might look like for a Metadata for Machine Workshop in November. Let me see if I can, here, I'll make this a little bit bigger. Right, so you can see it. And this is just a sketch. I don't know if this is going to be the actual program, but the idea would be that we would have basically a 5-hour day for the Metadata for Machine Workshop. So going from 12 o'clock noon to about 5 o'clock in the afternoon. And we can always tack on a bonus hour at the end, just for questions and resolution of issues. But the idea would be that, we could have a kind of preliminary preamble on what it is we're trying to accomplish in this Metadata for Machine Workshop, and some of the components that we have to work with already, what the domain specifications look like, the domain relevant standards look like. But then the rest of the day is basically a review and selection process and modification process of some of these existing metadata templates that we build in October. And we fit them better and better for the purposes of this cluster group. And we can do this with the Cdr skills that we have developed through October and refined in November. And we can do this with the assistance of the development team, with Nicola and Barbara and Christina, for example. So that's an idea about how this could look. If things go really well in October, I think these workshops become much more actionable. If we don't make as much progress, then we can at least have these workshops in order to trigger commitments to some standards that we can document for the program. And then lastly, to jumpstart this interaction between the development team and the data stewards, here's a link to a document, a Google spreadsheet. I'll put that in there. And this is, I haven't mentioned much about the FAIR implementation profile idea, but that's this, this list of implementation choices that are made in order to go fair, in order to be fair. And one of the most important and most difficult elements of this is the list of standards and like data standards and code vocabularies that you would like to use in your research project. So what I'm asking the data stewards to do here, starting today, but going through the month of October, will be to list as well as you can in this column C here, in this orange column, to list your ontologies, vocabularies, controlled, or let's say data structures, data standards, any metadata schema that you already use, anything that is your like data related and fair related, you can list in this column. And if you can, please attach it to the cluster group that you're in. And there's a few other things. There's, I think there's, if you have a link to that resource, that's great. You can also mention the project number that you're in and any other kind of text comments that you want to make. And this is going to be the beginning of an inventory that will be very helpful to us in October when we begin to build components, metadata components that are COVID specific. And I think what will happen throughout the program, especially as the FAIR data points begin to be connected by in some kind of portal environment, that there's going to be kind of an ongoing negotiation or discussion. Hey, what's the best implementation choice? How are we going to talk about proteins in the COVID program? Are we going to use UniProt identifiers? That's an excellent question, and there may be multiple opinions out there, but it's something that we should resolve in the course of this metadata exercise. We can also, I don't know, maybe there's ways of representing case report forms. So we should understand what those case report forms look like and if they're mappable between each other. If not, then how do we come to an agreement on the way we're going to collect case report data? And that's going to be where the domain expert is really in charge, but the metadata experts and the data stewards will be there to help translate those decisions into the machine actionable components of their data. So I think I hit the time mark, and I'm happy now to take questions and have a discussion if you like. Again, I know it's a lot of information that's coming at you, but I hope it's not too overwhelming and that there's a sense of excitement in terms of the being able to create some new components here.
So maybe it's good. There's one question by Jeffrey Cole. If others that are in a similar position about the questionnaires, because that's probably also the underlying question of Jeffrey, which is what we try with the workshops as well. If people are using questionnaires, if we are going to come up with a metadata scheme for those kind of questionnaires as well. And those can be used in multiple domains, not only in care, but also in socioeconomic sciences. So if you are using them as well, please in the Google Doc, we have started a discussion there based on the question, indicate whether you do so, because then we can take care of that during the workshops as well.
Yeah, and again, this is like, I think such a, this could be a really wonderful example for the program, for the COVID program, because indeed there's, so number one, questionnaires can be obviously considered data, right? They're data sets. So the generic data set schema that we have can be perfectly applicable to the questionnaire as it could be, a tabular Excel spreadsheet type data. So that's nice. I think it fits perfectly well into this generic data set metadata component that we would like to build. And then this other situation where, yeah, there's questionnaires, sometimes in very different domains, we're asking very different questions. That's true. But then the really interesting question is, if you describe your questionnaire and your data that's been collected in one domain, and then you do this again for another domain, the question would be, what's the overlap of your metadata descriptors? There's still an author, there's still a time and a date stamp, there's still funding under the COVID program. There's a lot of generic elements that are in common. And not only can we begin to find these common elements within the COVID program, but then a lot of them should pretty self-evidently be common for any data collection of that nature. And so long as that template can be made available on the Cdr OpenView platform, then any group in the world would be able to repurpose that metadata schema for their own purposes. And what they would see is that there's actually metadata about this metadata component. And they would say, oh, here's a metadata template that was created in the context of the ZonMw COVID program. If it's good enough for those guys, it's probably going to be good enough for me. So I will reuse that template rather than reinvent that wheel myself. And if we can get that kind of dynamic started, then number one, it just saves a lot of time on redevelopment of the same thing over and over, but it also begins to drive convergence on standards, because if I reuse your template and I'm modifying it only for the really specific domain elements unique to me, then already we begin to set up an interoperability between my surveys that were collected and your surveys that were collected. And that could be a very powerful driver of data interoperability, and a whole new set of research questions become possible at that point. Any other questions?
I see a question by Maaike herself in the chat. Or was it only meant for me, Maaike?
No, it was actually a reaction to Rita, but it was again about the clusters, because there were some extra questions about the clusters and whether we want people to indicate that they are indeed in the 12 clusters, so the socio-economic behavioral cluster. If you have the feeling that you are in that cluster, you might want to add that to the notes so that we already know.
Yeah, and I think early on, wasn't it the case, Maaike, that that we thought maybe this organizational process-related cluster, could in principle serve also for the socioeconomic behavioral people, but if there's a need for that sixth cluster, I think that's probably even better. And
yeah,
one thing, just to mention, these are, in my mind, these clusters are really just a convenient way of spreading out the workload on the Metadata for Machine workshops. Yeah, there's some topical relevance here, and that's a good thing, but I don't think it's a big problem if you see that you might fit in multiple categories. Just choose one, and I think it'll be fine. Or if you feel like you've been put into a category that's not the best fit, you can certainly try and adjust if you'd like, but just see this as a way for us to kind of manage the workload and spread it out. It's I think we have enough overlap in these projects that we will always find a productive Metadata for Machine workshop.
Can I just
also add your information on the clusters to a link that I'm adding into the because some of you haven't added already the information on availability, and we closed the spreadsheets that we had in the information session, so you can add your availability via the form that that I linked in the chat.
Nanka, you were going to ask a question.
Sorry.
Let me just unmute myself. I was actually going to say, I think it's a really good idea to add that last cluster, because I come from an economic university. So to hear that most clusters have a very biomedical orientation, which of course is very logical because it's COVID. I think it's actually a very interesting opportunity to see how you could make something like this work for, in case of less, of more various non kind of biomedical data. Because the topics and variables that they collect are so incredibly varied. So I think it's actually a very interesting exercise to see if you could standardize something like that as well.
So Nika, this category of socioeconomic behavioral cluster, it seems to me like that cluster could be funded in every ZonMw project, right? I mean, for any disease category, I think you could ask really interesting questions. So let's just for the moment entertain the idea that ZonMw would do this from now on. The metadata components and the decisions that you make at this moment in the next 8 weeks is probably something that would then carry over into all those other research programs. Yeah.
Well, of course, I think so too. It's just that I also think that non-medical research has lots of a lot of different types of questions and data sets compared to the more medical ones. So I think you will see quite some differences. And I don't know, but I always thought that ZonMw and NWO were like two hands on the same, well, they were going hand in hand. So maybe you would see more of these kind of cluster questions for NWO and COVID type research. Or I could be wrong, but...
You're right, Nienke. And of course, there's always, even if you're in a socioeconomic field, there's always a link to the, let's call it the health, the health, because that's why you ask for funding by ZonMw. So don't forget that it should be not off topic, so to say. There's always a relation with the topic.
Yeah, definitely. All right, cool. But I would be very much looking forward to having a cluster specifically for this type of research. I would feel much more at home there than at other clusters.
Can I ask you, Nienke, the spreadsheet that I linked you to just now, where I was asking for some standards or some ontologies, is that something that's easy for you to fill out right now?
Let me just...
Is it obvious how you would go ahead and want to do that?
Look at the chat, Eric. There is a remark by Koster NM.
Yeah.
That there are some difficulties, so it depends on what you would like to obtain.
I haven't looked at it yet, so let me get back to you later. So continue with the presentation. I'll just have a look at it quickly.
Sure. I would say, yeah, can we, so Koster's question boils down to, can we adjust the categories here? And I think on the one hand, the answer is certainly you can, fit as you would like your standards and your ontologies into an alternative schema. But at some point, I think we want to map it back to these 6 cluster groups. So maybe in the comment section, in the considerations at the end of the spreadsheet, you can describe the domains that you're working in. But I think it's also wise to go ahead and try and cluster it if you can. I mean, if you're really not within one of these clusters, we'll have to talk about how to do your metadata. So let's try and go with this clustering if we can for now, but definitely comment on the domain that you're working in.
There's also the question for Femke. You can, if Femke said she wasn't able to add the project number, but you can use the links. Is to fill in your availability, but maybe that's what you're saying, that you need the project number.
Yeah, maybe you can try, I don't know, not applicable or something, and then
And
I
let's
don't know, we'll match it.
Yeah.
It didn't work. Without a
Oh.
project number,
But
even a fake number, I couldn't fill in the form.
I could fill in a fake number this morning, so you should be able to as well.
Okay, I will try it again. That's why I also now logged in as an observer and not as a data steward.
Okay.
Yeah, Eric, so there is another question I was asked by one of the participants via the Slack channel. So that kind of talks about, well, runs ahead of the metadata scheme. So the different metadata schemes, are they strongly connected to the cluster that you choose or that the project will fit into? Or how does that work? How do we create those metadata schemes? Will it be 5 metadata schemes or 6 metadata schemes because we have 6 clusters? Or could there be multiple metadata schemes within one cluster or overarching over the 6?
Yeah, and this is, I think, an answer that, all of these are possible. And I am sort of waiting to see the research projects in the clusters, how that lands before I think we can come up with a good answer. What we want, I think, is to make sure that we are identifying in the program the most generic high-level elements here that cross-cut as many of the other research projects as possible. That's our target. Those are the decisions those are the places where we want to make decisions. There will be a moment where you sort of leave behind these generic elements and you begin to get into very experimental specific or project specific elements. And so we need to kind of find that line. Certainly we say that, I think every project will be creating data sets. And that's why we decided on a metadata schema for data sets. It also comports well with the fair data point. And so then the question is, well, what kind of metadata elements are in that data set descriptor? And I think what we created in the Danish experience, I think we had up to 90, different elements that you would collect. So author, time, date stamp, that sort of thing. But there was a schema that was created in the context of these weather data streams. We will try to create this, I think initially, at these high level 5 or 6 category distinction differences. And we try that. If it works, great. If there needs to be a finer level of resolution on this, then we will discover that and I think figure out solutions if we have to. So it's always kind of keeping your view at first at this highest level that's most generic. And from there, trying to figure out how to then describe your data sets in more detail relevant to your project.
Correct, Eric. So that's why I made a remark in the minutes that you should choose the cluster which you fit best to. And if you have multiple clusters, please provide a comment. There's also a comment field in the registration form, and then state I'm in automotive, for example. Then okay, then it's clear. At least then we know the domains. So if a domain is not listed, put it in the comments at least. But provide your cluster you fit best to.
Yeah, and we understand that it is even more complicated as in the case of Jutta, who asked the question. She is a data steward on 5 or 6, even 6 projects in Erasmus. And her dates don't suit the dates of the PI. So I think it's a big puzzle anyway to get everyone in one of the workshops. So we'll try to be a bit flexible there, I think.
Yeah. Yeah, and indeed, we will have to, and I think in a way it's always we have to tolerate some, noise in the system, especially when we're thinking about data modeling or metadata modeling. The most dangerous thing we can do is try to aim for perfection. We can use up all of our time debating issues like, for example, is a wind speed of 0 still win? And it's kind of a philosophical conundrum, but when you're data modeling, it's a real question you have to figure out how to answer. And I'm really happy to say that this was not something that blocked us in the Danish experience. But this kind of danger lurks everywhere, that we really want to go for some kind of precision in our data modeling. It's good, but we can also get a lot of bang for the buck just answering very generic high-level decisions as well.
Maybe it's a good idea. We used it in our other meetings as well, a kind of parking lot, so that if topics come up which we cannot address or which, let's say, move the focus off, then put it on a parking lot so that at least people have the opportunity to at least expel what they are expecting.
So absolutely, and like I say, I think my job in particular, once we start going forward, I will be working very hard to try and document these questions that are coming up, really at the level of this generic specific distinction, and also in like this cross-disciplinary interaction. So, how is it going to be the case that the socioeconomic behavioral group, in their metadata descriptions, how will they be able to actually interoperate their data with some real biomedical patient data? Obviously, that kind of data integration would be awesome, but it's a big challenge. And so, indeed, Jeroen, I think in the Metadata for Machine workshops, we're going to raise a lot of questions that are going to need to be, I think, well documented and figured out how we approach them later on. I'm curious. Yeah, oh, go on.
Sorry, Eric. There's one suggestion made in the chat that maybe we could also look at the keywords in the proposals to cluster use for clustering. But we've been thinking about this already, and it's quite a task with 50 plus projects on our plate. Yeah, so this is a good suggestion, I think.
So one idea that comes to mind, since we'll have John Graybiel around for a couple months, maybe it would be possible to create a Cdr form for keywords on research proposals that would be completed by the applicant at the time the proposal is submitted. And this would be something then that could be used to cluster projects later on. And this could be done in a much more automated way using the Cdr template. I'm sure over time we're going to accumulate a long list of to-dos for John. Although, to the degree that we train up this capacity within our own group, this is another example of a development possibility. Some of the data stewards on this call right now, when you get into Cdr, you would be able to design such a form on behalf of, for example, the ZonMw. It's really just metadata, right, about the research proposal. So I see it's 3:50 at the moment, and according to the agenda, we're supposed to take a coffee break. So if that seems like a good idea to everybody, I think I had this here. Don't forget your Cdr account. And I think it's wise we can take a 10-minute break. Everybody relax for a little bit. And in the meantime, we'll see if John Graybiel enters into the room. Thanks, everyone. Appreciate your interest and your time. And we'll see you back at 4 o'clock.
See you.
Hello, Eric. Hello, Eric.
Hi, John. Welcome.
Thank you.
Yeah. Right on time.
Yeah, a little later than planned, but do what we can. Right.
Yeah.
Somebody didn't mute their mic.
We know.
Yeah.
So John, let's give it another 2 minutes for people to come back from their short break here.
Excellent. Do we want to switch over the sharing? I can share mine.
Yeah, absolutely. Let's do that.
Is Margreet online? Because as a host, she could mute everyone and then unmute you again, right? As a host, you can overrule the muting.
That's correct. At least it used to be correct.
Yeah, it used to be correct. Yeah, but I don't see the host screen yet. So if Margreet is already online, she should be able.
Okay. Yeah, John, I think we're hovering around 70 people.
Another tiny crowd. You
Yeah.
can't get a whole bunch of people, Eric. Jeez.
Yeah. Well, we got 50, about 50 people who are actually in the COVID program, and then the remainders are observers.
Mm-hmm.
So apparently a lot of interest.
Wow, what a fancy background, John. Is it a special
Thank
plane?
you, yes. Yes, it is. It's the Kuiper Airborne Observatory. It's a blast from the past.
Okay.
A telescope on it, so it did a lot of flying at night. I'm reliving the glory days of staying up all night to give trainings.
What time is it for you?
It's just 7. It's not bad at all.
No, you're at dinner hour. But we'll see you later on in your day. We're going to see you.
You'll see me much later in my day. Beginning of another day for you.
Yeah, so not dinner hour, breakfast hour. Yeah.
That's right.
Yeah. One question, John. How do they stabilize a telescope on an airplane?
First, you put it on 4 big shock absorbers, and then you create a air bearing that is about, I don't know, 3 feet around, 3 feet across, and that supports it floating on air, so the telescope will stay there even as the airplane swivels back and forth.
It's the same as the how do you call it, platforms on sea? They have gyroscopes.
Yeah.
Okay.
Yeah, it'd be very similar task. That's right. I'm going to grab my other glasses. Give me 1 second.
Yeah. John, I'm going to introduce you while you're gone.
Okay.
Because I think everybody's probably coming back now. And so this is John Graybiel, and he's a technical lead on Cdr and BioPortal at Stanford University. And John and I have worked increasingly closer together, especially in the last 6 months, driven by these Metadata for Machine workshops. So I think we're getting better at how these things are put together. But anyways, John, I would like to hand you the floor and take it from there.
Thank you. I am happy to be here, and hopefully we'll be happy to be sharing momentarily. Let's see if this works. Are you seeing my screen that says when system dialog prompts?
Yes, we are.
Okay. Good. All right. So I'll just kick off by saying I know you've been prompted to do this, but in case you haven't had time yet, please go ahead and get your Cdr account if you want to play along. I know we have a lot of people who will play along. It'll be an exciting stress test for Cdr. I'm getting some significant feedback, Eric. Can you see it?
Yeah, I hear it too, John.
Anybody can be muted.
Yeah, if our host, maybe can you try to mute, maybe? Yeah, better.
There might still be a few of us that are not muted.
Yeah, it looks like it's might be coming from, there we go, from Rita's. Thank you. Yes, good. Thank you. Excellent. So I am doing the second training, as Eric has no doubt mentioned. We've done a much larger and longer training on many of these same concepts, and I am this is a consolidated version of that, intended to give you just enough information to make it interesting and potentially cause much excitement. So enjoy playing around with what you learned today and tomorrow, and don't hesitate to send us email if you need us to help you with anything. And let's see here. So there are a couple of logistical things, one of which is I'm going to shut my door. Give me 1 second. Oops. I lost my doggy. We'll see if that continues to be the case. So when you're working in Cdr, the folder that I created that you'll see for everybody is a common folder, and it's readable by anyone who has a Cdr account. If you want to have a private area for something you're working on, then your own workspace is a private area, and you can create materials there if you want privacy. But we're going to assume today we're not worried about proprietary content. It's a large group, and so I'll try to take questions during the break, if not before that. If something is really confusing or in the way, please interrupt to ask. I imagine that we'll have people who are able to monitor the chat and Slack channels, and they can also, if somebody has a question that's important, feel free to bring it up. I don't have a problem getting interrupted. I just know there are so many people might not be able to answer all the questions. If you're having trouble getting a Cdr account by now, then that would be a good, I'll just let anybody raise their hand now if they have some concern or issue about that. Although I have to say, I don't have any backstop this morning. If see something happens to Cdr or BioPortal, we'll just have to defer Cdr activities until this evening, when I will have somebody who can back me up. I've posted here a number of references, and the first of them is a list, even longer list of references, all about Cdr, many different kinds of references. Just guys, see your hand is up. Did you want to ask a question?
I think there's only one question from Yitkas, because we had some problems in logging in, getting an account in Cdr. Some of us got the verification email in the spam, but one of us at least, not even that. So maybe it's something for us to connect you, or
yes,
solve this already now.
We have definitely once in a long while we have that problem where the email goes to spam, and it can be hard to chase down. I might suggest trying again with a different email if that's possible, and we can try to sort it a bit later on if we can't figure it out that way. Okay. Thank you for that. So you'll be seeing a number of videos today and tomorrow. These are all available in the training playlist, and there's a COVID instance in OpenView that I will refer to, and that bit.ly will help you see that one. And there's a attribute spreadsheet that I'll mention, and there's a bit.ly for that. I've put these in the presentation. I've given Eric the link to the folder, and there's a PDF in there, which is today's presentation. So people are welcome. Excuse me. People are welcome to download it and pull the links that way, or they can be pasted into the chat as well. All right, going to start with just describing what I think we're trying to do in the general sense today and for the future. I think we want to learn a path toward FAIR that uses the Cdr system. And this quote is from some of the materials Eric has put together about what GoFair is all about. The idea being that policy and domain experts can build new metadata or data schema, or they can make informed choices regarding the reuse of already existing data or metadata schema. And the schema are the things that tell the users what they can fill in, what kind of information is needed. And so we're trying to build better metadata forms and tools. So we're trying to use really good practices, really fair practices in those forms and tools, and make tools for doing that more readily available, and make the resources that are produced able to be built on, that people build on each other's work, so that those resources get better and better. We'll use Cdr and BioPortal to illustrate this. I'm not going to be able to tell you everything, be an expert in Cdr, obviously, but we'll get you going and help you know how to go forward. We'll be talking about metadata a lot. You can think of these as data issues too, and I'll talk a little more about that later on. So we'll talk about 4 facets of the work that you do and what we have to consider. Metadata, vocabularies, being fair, what that means, and architectures. And I can't say I have a great read on you who are the audience, but in my head, I'm imagining that many of you are curators of different levels of technical competence and expertise. Many of you will be familiar, at least to some extent, with data systems, building them, and so on. Some may be even experts about that. But for some, it may not be that familiar, and I've tried to split the difference here. So I start by asking the question, what do we mean by metadata? The standard definition you may have heard is data about data. These are the meanings of my values, is how I roughly interpret that. Here's my values, and here's a definition of each one. Have at it. Metadata is about much more than that. It's about the origins of the data and its provenance and its context. And this can even include a precise description of how to interpret a particular number, how to decipher it, transform it, etc. And if there are complex processes involved, the processes that are used to create the data or metadata are essential. If the work involves medicine, there are really complex processes involved. There's software and there's hardware in the system. There's wetware, or people, as most of us call them, and workflows, the actual places that the information goes from one step to the next. All of that is important. The places the patients go, the places the drugs go. All of that can be important in understanding where the data came from. And all of those can be described by metadata, or sometimes about data. I'm going to give you a very short form of this story about ocean temperatures because it's a little bit out of scope. There are many comparable stories in the medical domain as well. People have been studying the temperatures in the oceans for a long time using instruments that they could lower through the oceans, like these XBT instruments you can see in the background, and Argo floats that float on the top and then sink down and come back up every so often and float around for decades taking measurements. And at one point, there was a significant change noticed in the ocean temperatures in measuring the heat content of the ocean. And you can see it in the graph at the upper right. The change was noticed in the upper, the thing that has a blip, the upper line that has a blip that says original data or uncorrected. The oceans seem to be gaining heat content in a way that wasn't clear why that should be happening. And it took a fairly long time to figure it out, but they eventually realized that the systems, the Argo float and the XBT instruments, were biased. And as a result, they were increasing temperature to the data. Well, they were able to go back and fix this much after the fact, years after the fact, decades after the fact. But in multiple cases, they found that they couldn't actually fix it as well as they wanted, because either the profiles that were archived themselves didn't have the essential metadata, or the profiles were documented pretty well, but the high quality data that needed to go with that system wasn't, with that measurement wasn't available anymore. They didn't know which instruments were deployed on which ships at which times. And so it turned out that because they couldn't figure out which instruments were used in the measurements, they couldn't actually come up with accurate understandings of the values that they were seeing. So the question is, how much metadata do you need to pay attention to? Do you have to keep going back and worry about the instruments and worry about who calibrated the instruments and worried about where those people were born and so on to understand perfectly what was going on? And yeah, maybe you have to do that if you want to understand perfectly. But in a realistic world, we can't do that, nor should we. And I've created my own redefinition of metadata. I don't think it will ever replace the original, but for our purposes, it helps to think of metadata as information that's useful to work with data. Or if you're dealing with actual data contents, you might say, what's that data for? It's information that's useful to answer your questions about what you're measuring and other things. And so if we think about information that's useful to work with data, the question you might ask is, useful to whom? Who is it that wants to work with the data? A lot of people may want to work with your data, and especially if we're talking about things like medical results, especially if we're talking about things in a fast-moving situation like COVID, then we can imagine a lot of different scenarios where this data might get used over time. And so it's easy, I think, for most of the people in the room to appreciate that the people who are understanding their data may be someone who wasn't associated with the first place, not working in this domain necessarily, not necessarily speaking the language that we did when we entered the information. And it might be 10, 20 years in the future. And it may even be that the meanings of some of these terms have changed. So the premise of fair data is that we want this data that we're creating now to be findable and understandable and interoperable and reusable across all sorts of situations. Different individuals, different languages, different domains, timeframes, long scientific understanding. You can only go so far, but you want to cover as much as you can. And that's the practical approach to how we deal with it. But to help people visualize it, I like to think of taking the data that's coming out of our systems and putting it together with its metadata into a time capsule of some sort, and maybe feeding this time capsule through a portal. And it's going to go to somebody on the other side of that portal. We'll stipulate that they're human and have some basic understanding of how to unpack what's on that data in the time capsule. But they really need to understand more about that information than just how to unpack the bits and bytes. And one of the most crucial things for them to understand are what the meaning of these things are. And so vocabularies and terms are really critical to this kind of interoperability. But often these are thought of last by the people who are building systems. Often they're not thought of at all. And so FAIR is, the concept of FAIR is part of the solution to the challenges in this. And we know it stands for findable, accessible, interoperable, and reusable. I think of it as mostly interoperable. But you can use your own engineering understanding of it and get pretty close, I think. And it has a couple of different aspects to it. There are the principles itself, which were pretty vague to begin with. And I think before we even start talking about that, you'll see in some of these principles this term, parenthesis, meta, close parenthesis, data. And it's useful to understand that can mean data or metadata, which is particularly appropriate for our talk today, because I think we're in a little bit of an ambiguous space as far as some of the data we're talking about collecting with some of the examples you see, the COVID examples you'll see. So when you see this word, think of it as metadata and data. And so if we look, for example, at one of these principles, we can see that the principle is sort of simple and high level. Metadata are assigned a globally unique and persistent identifier. But then when we think about what that actually means in its implementation, then we need to start looking at guidance that comes from groups like the Metadata for Machines Workshops, Go Fair, Fair's Fair, others, who say this is saying that the domain community needs to have a policy statement about identifier persistence. And this is how M4M is dealing with this. And then if we say, well, how are we going to evaluate that if we are going to test whether something is fair or not? This is one set of proposals for how we might evaluate that, is to say, for identifier uniqueness, whether there's a scheme that is going to uniquely identify the digital resource. For identifier persistence, whether there's a policy that says what the provider will do if that scheme becomes deprecated. So these are more in the evaluation stage. Yeah, question? Question? Not a question. So some specific tests have been developed, and we'll come back to those, but the point is that there's a long way from a principle to actually knowing what to do when you're developing a system. And we're going to talk about some of those intermediate tools that help you ideally satisfy the principle and satisfy its implementation and even its evaluation, but without you having to know every detail about all of these technologies and approaches that I've just described for one particular case. So fairness and fair is an evolving state of practice. It's the best thing we have as a starting point. It's not a fully fleshed out, mature, everything in place, Six Sigma quality kind of engineering tool, but it's a good starting point, and it clearly shows the different areas we have to consider when we're creating our data or our metadata. And we need to consider it especially as we're dealing with your needs when you're building data systems. You're always going to be making judgments as you're building data systems, as you're filling out metadata as curators. And so I say use engineering judgment. My last talk was to engineers, but you can think of this really as use your good judgment when you're dealing with this metadata and how you're filling it out. Think about the people who are coming after you, who are going to have to figure out what your information means. We think that adopting fair practices should make our products more fair. And it's the judgment of the people actually applying it that's going to make them more fair. So my last point in this section is about architecture orientation. Give you an idea of how we talk about these systems that a software like Cdr operates in. And so if you're talking about a data system, for example, it might look something like this with all of these things could be multiple. You'd have sensors out sensing things, and then there's a service that talks to the sensors, and then there's something that aggregates that data, and something that stores the data and maybe runs analytics on it. And there's something that distributes the information out to the people who need it. And there's somebody running this whole system, and that's a very simple view of an architecture of a system. And it's important to appreciate that a sensor here is not simply a probe that is a mechanical thing you hold up in the air and it measures the temperature. It can also refer to any kind of measuring system, like a survey form, collecting information, or people who are watching and seeing how many animals are in the sky or on the ground, or what kinds. Can also be software, can be a system that's measured with a sensor. And so it's a very broad concept, and I'm not going to go into the details of those definitions, but we can go to medical flows and thinking about medical environments and what we are doing when we are trying to understand the course of diseases, whether through biomedical studies of tissues and the like, or by clinical studies of actual people in the actual hospital or care setting. There is a lot going on. There are measurements being taken by all kinds of systems. There are all kinds of entities being used, solutions and drugs and things like that. There are the people who are both the patients and then the people who are trying to help the patients, all the way from when they first call 911 or whatever happens to getting them out of the hospital. And there are the measurements that those people are taking and the notes they're taking. And there are, of course, all of their sensors. And so the streams of information that are coming are very sophisticated. Fortunately, none of us has to handle everything in that stream at one moment, except after the fact. If people are doing analysis, they are often trying to handle a lot of things that have happened at a lot of different times during the process of someone getting sick, being taken care of, becoming well again. All sorts of events are happening, and not just to that person, but to all of these system components that are a part of their care cycle and to the people who are taking care of them. So it's a lot going on. And if you ask the question, who's the metadata for? Why are we creating this metadata? Or who is this data for? Why are we creating it? A significant group of people who are using this information that we're creating aren't even on this diagram. It's all those people represented here by the internet who are analyzing the information after the fact and trying to understand better whether things are successful, what might cause issues, all sorts of things they're trying to analyze and understand. Sometimes you'll see this diagram that I just showed you that has all of this complexity on it. You might see it looking a little more like this, just to be simpler to look at. And I'll just close very quickly by talking about all these things that are going on, just to bring home the point that it all has a life cycle. You have the metadata itself, which can change. When we fill out one of these forms that we'll talk about today, you may realize 10 minutes later that you need to change something, or an hour later that you need to change something. I don't know that the systems we have for dealing with, for example, COVID forms are going to be built in a way that let you do that. Cdr is built in a way that lets you do that. You can go back in and change it. And so that step is covered. And so it's a bit of a question that we get to think about as we use these forms across more and more systems. So the metadata can be changed, reviewed. It can have a whole life cycle all on its own, which we won't go into detail. Just be aware it can change. More metadata comes, more data comes. These things are stream. Think of these things as streams. Even if you fill out the form once, for the most part, sometimes you go back in forms and fix them, or someone else goes back in and fixes them. And they're not a final, permanent, all-inclusive record the instance you finish filling out one. The sensors have a life cycle. The sensors can change. We talked about that in the ocean example. The software can change. You can imagine how it confuses things when people are using different sensors that are calibrated differently, and different software with different algorithms for deciding if someone's sick or well or anything else. So that's very valuable to keep track of. The vocabularies that people use change. The actual terms change as you go from ICD-9 to ICD-10 to ICD-11. Literally the words we use to define disease change on a regular basis, and as our understanding improves. So lots of different things that have happened that affect these terms, and that's important for us to appreciate when we're writing down terms and thinking, I'll just write down this term as diabetes, and that'll be good enough because everybody knows what that is. Well, it changes a lot what people think diabetes is over time. The people themselves change, as we've discussed. Knowing who did something is important. And one nurse or doctor or clinician could have a very different impact than another one could. So when you look at the big picture, everything is changing all at the same time. And the one thing we want to try to do is when we create an identifier for something, we would like to be very clear that that identifier is either referring to a very particular thing that isn't going to change, or is referring to something that changes all the time, but we understand that. The example I like to use is the New York Times. If you want to have a link to the front page of the New York Times that works every day to get the most recent newspaper, you could have an identifier for that always takes you to the front page of the New York Times. Sorry, that's a very American example of a newspaper, but you get the idea that even though the actual content there changes all the time, the idea of going to the front page is the same. And in that way, that identifier is persisting. So in general, we want the identifiers for our terms to be referring to a very specific concept that is extremely unlikely to change, or at least that we can put into context. If it was in 1990, it may mean this, and in 2000, it may mean that, but you can understand that from the context of that identifier. So I've thrown a lot of things out there. It's more or less an introduction before we get to our first exploration of Cdr. And I'll just pause briefly here to see if anything I said was particularly confusing or annoying or needs a clarification.
Thank you, John. There were 2 questions, 3 actually. Yes. So one question, part of the remark, was whether standard operating procedures are also part of the metadata. Is that correct? I think you said it somewhere at the beginning of your talk.
Yes, they definitely can be. They should be part of the metadata. That those procedures in some written form can be referred to and captured so that people years later can see what the procedures were. And ideally, parts of those procedures may be described elsewhere, and it would be nice too to have those captured.
Yeah. And then there was a second question, whether there is a difference between metadata and a data dictionary. It was asked by Ezekiel.
And to point to John, there is also already an answer by Suku Singh, Shuki Singh. So you could comment on that answer as well.
Let me bring up, is this in the chat, I assume? Yes, I see.
Yeah.
Right, great. So I think of a data dictionary as being a specific example of information that is collected about data. I think Suki's description here is helpful in its precision in detail, and I can say that I've just as metadata, I've seen data dictionaries that are far less impressive than that description. So it varies, and I think only the generality is different. That metadata is referring to all expressions of descriptions about data, and data dictionaries are typically a specific entity or repository of information, and so it's maybe a slightly more focused concept, but very, very much overlapping in their purpose and their goals.
Thank you. And then there was a question by Sakinat, whether sensors take image data.
Absolutely. Sensors these days can take just about any kind of data. Still images, moving images, images and wavelengths we don't see, including wavelengths like sound images. And so really you can think of a sensor in a very general way and be correct.
So I think these were the questions, unless there were some other questions in the document. Let's check.
No, I don't think so.
So we're going to dive into Cdr with a bit of hands-on tutorial. I haven't really said what Cdr is, and so I should maybe just give you that quick overview for those of you for whom this is completely new. You can think of Cdr as a form builder, much like Google Forms or SurveyMonkey. There are many such form builders in the world. And the idea of Cdr, like those other forms, is that a user can come in, build their form in a fairly simple drag and drop way, specifying things about each of the values, each of the questions and the potential values, and then hit the button, and now other people can fill out the form. And in that way, it's very much like those other form builders. The thing that is different about Cdr is that it is built, I would say two things are principally different. One is that it is intentionally built in a way that it can be incorporated into other systems using the APIs, so that it can be a part of other medical workflows and biomedical workflows, and really for any domain that has a system, it can be included in other workflows. And the other thing about it is that it is attuned to, it cares a lot about making the results semantically meaningful. And that's unlike almost any form builder that's out there. There are very few that have some of the features that Cdr has. And so we'll see a little more of what that means as we go forward in the presentation. But for now, the way to think of it is, it means when you have values that you're entering into your form that you might typically enter by typing in a string of data to name something, Cdr makes it possible to control and specify very precisely what those names mean. And it's still quite easy to fill in, even easier because Cdr knows what the potential names are that the form creator allows. But once it's been entered, the metadata is very precise about what that particular phrase means. And we'll see that as we go through the process with Cdr. So if you start out with Cdr being a form builder, I think you'll be fine going through all of these presentations. These are videos, and I realized that I'll have to try playing the first one and see if I've set up the audio to let you all hear it. If not, we'll fix that. So the videos themselves, a number of them are built around a slightly different group. That one was called the FAIR M4M Dike group. This one is not called the COVID training group, but I believe that using COVID training as your search term will find the folder we're looking for, which is M4M ZonMw training, if I recall correctly. Go FAIR M4M ZonMw training, or the other way around. We'll see. So we'll have a look afterwards in Cdr and see what it actually is like. All right. Mika, I see you're on, I can see you. So if you're not hearing this when I start playing it, wave your arms and I will stop and reset.
There is no sound yet.
No.
Okay, hold that thought then. Let's go back one or two, and let's go to our settings. And I think it's advanced. Oh, no. I will accept input as to where the setting is that plays my system video, system audio out to the group. I was pretty sure it was here. If somebody has the moment to look that up online, I know it's here somewhere.
John, is it
Yes.
a link we can also, if it's a link, I can try to play it maybe.
No, we could do that, but I'm sure I managed to correct this in the last presentation and forgot to set it up this morning. So I'm pretty sure it'll be straightforward. And just a matter of finding it. So I'll look it up real quick. Sorry about that. Eric is always excellent at filling in these situations.
Well, my first question is, are we lacking metadata here?
Share computer sound. Yes, I see it says share computer sound. Ah, it's when I start the share. Okay, got it. Sorry, I'll have to stop and start sharing here. Yeah, there we go. And we are back. Let's start by getting to the desired content. In this case, a folder called Go Fair M4M Workshop. Enter Fair M4M in the search bar, and you get a lot of responses. You can hide certain artifact types by clicking on their icon. We can also change our view to a list format, thank goodness. We see the folder we want at the top of the list, and we double-click to visit it. The interface is based loosely on Google Docs. You can see the folder path at the top of the view and can view metadata about any item listed. If you want to explore, these choices show you your own content, all content shared with you, including content shared with everyone, content shared just with you, or special folders like shared, where our folder lives. Everyone can see everything that is in the shared folder. Let's have a quick look in the projects folder. Nothing to see here yet, and so you can back out and instead visit the demos and examples folder. This looks more promising. Here are examples of all of the Cdr artifact types: templates or forms, elements, fields, and metadata instances or filled out forms. If you don't see the fields, it's because we hid them at the beginning of the video. Now we have shown them again. So that's just your very basic front of Cdr. And I noticed I inverted what shared with me and shared with everybody meant as I described that somehow. That was entertaining. And I'll look for the raised hand or people jumping in between videos if they have a question they want to ask. All of these videos, as I mentioned, are in the YouTube Metadata Center channel. And in this video and many others, you'll be working with Cdr artifacts. Let's start by having a look at an artifact, like this filled out form, what we call a metadata instance. Double-click on the metadata instance to open it. You can see the metadata instance displays like a form, with filled out fields inside it. The form offers the usual conveniences, like drop-down menus with autocomplete, help text to search for each field, and some syntactic checks against the field types. One convenience that is not so typical is the ability to examine the produced metadata in multiple formats. You can view the native JSON LD format or the same information presented in RDF, Resource Description Framework. Looking more closely at the JSON LD, you can see there is metadata about this artifact. Yes, that's metadata about the metadata that helps make it a more fair artifact. When we exit the metadata instance, we can use the information view to learn more about it. And if we have write permission, we can change various things about it. So that's the end of that one. And I perhaps should have mentioned this before I started playing these, but you'll be tested on this later by virtue of being asked to do these very similar things. And memorize everything you've just heard. And now there'll be more. Fortunately, Cdr's designed so that you should be able to jump in and just play with it to figure out what's going on most of the time. If you want to build a template, you could start by copying an existing one. For practice purposes, you can very quickly generate a form with a few fields to get used to working with Cdr. First, go into the folder where you have write permissions and want the template to be saved. Click on the green New Plus link at the upper left and select Template. Cdr will open the template designer for you to begin creating your template. Enter a name and description for your template, then click Save. We recommend using the Save button often. If you navigate away or your browser dies, you will lose any unsaved work.
Note the yellow warning notification, which is just telling me that I do not have save permissions in this folder.
Now create a few fields, perhaps representing metadata attributes you would like to track. If you are describing a sensor or platform, perhaps make the ID of the entity one of the attributes, and the entity type another. Don't worry about using controlled terms. We'll cover that in another exercise. When you have a few fields entered, click Save and exit the template designer. You can see your new form in the folder that you started in, unless you didn't have write permission there. Then it is in your home folder. Finally, let's try filling out your template. You can use the drop-down menu and select Populate, or just click on the metadata tag next to the drop-down menu. Cdr opens a new instance for this template in the metadata editor, and you can start filling it out. Again, you save the template. You can view what your metadata looks like in the tabs at the bottom. And navigate back out of the metadata editor to look at and change other information about the metadata instance. Double-click on the instance to resume editing its metadata. So far we've simply roamed around a little and created ourselves a metadata template and seen that we could fill it out. And now we'll talk about how to share that with other people or put it on the web so that other people can see it on the web. Earlier, we showed the menu for changing a metadata instance. This menu gives access to the Share menu, which lets you share your content with any individual or group you like for reading or writing. If you make someone else the admin, give yourself write permission first, or else you'll lose your ability to work with the artifact. You can practice by giving the GoFair M4M Dike group read or write access. If you are the owner of a project, create a group for your project by clicking on the group's link and entering the name of your new group. You can now manage the group by adding other members to it. In this case, multiple members can administer a group. Our last sharing demonstration shows you how to make your content visible to everyone on the internet. This also uses the drop-down menu for an artifact, but this time you'll use the Enable OpenView option to make your artifact visible. If this option is not enabled, either you do not own this artifact, or you are trying to enable OpenView for a metadata instance whose template is not enabled for OpenView. If it is not your template, you will have to contact the owner, or Cdr support list if you do not know the owner, to enable OpenView for the template. After you've enabled OpenView for your artifact, You can view the artifact on the web by navigating to the drop-down menu and selecting Visit OpenView. This goes to the artifact's web page, which is now visible to anyone on the web. The top center artifact name is an active link that also shows the metadata for the artifact. And that Cdr users with appropriate permissions jump back into Cdr to look at the artifact. You can disable OpenView for your artifact at any time. Then it will no longer be available to be viewed on the web, although it may remain in Google indexes for a period of time. Okay. So we're going to visit this page with Cdr. I'm going to try anyway to do that basic thing of getting you started with this. You're going to be asked here in a second to essentially take those steps, find the appropriate folder, figure out how to navigate to it through the community folders tab, and then view the contents that are there, build your own small template example and test it out, and share it with a group or with others. There is a group that is called something like ZonMw GoFair ZonMw M4M training. And so you can see if you can find that group to share your work with so that everyone can see it. Now, as it happens, everyone in the world can see inside this folder right now. So that won't have any particular meaning, but it'll help you get experience with the groups. And so let me see if I can do a little bit of that. We'll go to, we will go to Cdr. I think we'll be seeing my own workspace, which is a bit fuller than yours will be. And so if we want to navigate to the folder we're interested, I hit on community folders and then shared, and double click on shared to go inside it. This is the folder we're interested in, GoFair ZonMw M4M training. And if I had typed on something like COVID training, I think I might have seen the same thing. Yeah, it shows up as the second folder down. So I can go into that folder. I can check out all the different folders. The particular one I want to show everybody is the demo and examples folder, because it has links to examples. And so you want to click on the metadata entry here, links to examples, not the template. That will be a little bit confusing to click on the template. And then you click here to show all the links. And so we can see that there's a link to World Health Organization COVID-19 folder. These are materials that were used to build the case report form you saw in the earlier example. There is link to go directly to filling out that form. And this gives you a bit of instructions about how to do that in a way that it ends up in the assignments folder. You can either just click on it the way it is and then move or copy it to the assignment folder later, or if you control click and save the link, then you could put it in the top of your browser, and it should, you could migrate to the assignments folder first and then fill it in, plug it into the top of your browser. I haven't actually tried that. I think that'll work. Should work. Then there's another example template you can look at that's more detailed for describing almost any digital object you might imagine. And so I wanted you to have those so you could examine them and see what's in them, but also so that you can think of them as potential sources for what you might want to do. For example, you will see elements in the COVID-19 folder that are, let's just visit it briefly, you can see elements, they're used for section 1, 2, 3, and 4 for building up the larger thing. And you can examine each of those or even sub-elements of those to see how they're built. So a lot of things to get distracted by there. I'll jump back to, oops, got carried away. Jump back to our assignment. You'll have 20 minutes for this assignment. I'll be online for any questions. And so you can either chat with everyone so everyone can see it, which is best, or chat with me directly if you're shy. Or if I'm not responding for some reason, then go ahead and open up your mic and talk to me. There are a couple of things. Some of you will get through that in 5 minutes if you've worked with Cdr before, or you already know how to do all that and you're sure of it. Then there are a few other things that I have here that you can do. You can actually create a folder for your project in the projects folder to work with during the training. You can work with the versioning capability of Cdr. One of those drop-down menu items for the templates lets you version your template. And then if you've versioned it, you can create a draft in order to start the next version. And so that can be interesting if you care about such things. And you can hop to the documentation and see all the different information in the documentation. And finally, especially if you're having an issue, for extra credit, you could practice posting to the support list. That's cdr-support@metadatacenter.org. Sorry, should have written that somewhere. Or you can create a ticket in GitHub, github.com/metadatacenter with your issues and requests. So, sorry, yep, sorry. We are now at that stage. Does anybody want to ask a question before we start the clock?
Actually, I have one question, if that's all right.
Yes,
Can
that is, of course.
Yeah, can we do something totally wrong, like deleting the full folder,
Yes.
moving, overwriting things so the others are not able to do the things?
Yes,
you just described?
Everyone has write access to these folders. And so you could actually overwrite somebody else's work if you aren't thoughtful. Thank you for asking that question. So everyone, please be careful about what you delete, etc. And when you create your metadata, you will see it says something like, it'll have the name of the template followed by the word metadata. And when everyone creates their metadata, everyone will have something like that. And so ideally, you want to rename your metadata after you've created it so that you can tell it apart. But if that fails, you can use the information panel on each file and look for the one that has you as the creator, and that will tell you which one's yours. So yes, do be a little bit thoughtful and careful. Allow for the possibility that someone else may overwrite your stuff, or ideally, if you really are concerned about it, then you can just do your work in your own area. It doesn't have to, there's no rule it has to be done in the common area. Sorry, that was probably too much information. Did that answer your question?
Perfectly, thank you, John.
Okay, great. Okay, the clock is ticking, and you all have at it with Cdr. And you can just read the rest of the presentation or the documentation if you don't actually want to play with Cdr yourself. Or you can text me questions or ask me questions while I'm here. I am going to hide my video so I don't distract you, but I'm here. 5-minute warning on completing.
John, can I ask you a question?
Yes, go ahead.
I made the folder in my own workspace and would like to move it to the team folder, and that seems not possible, right?
I think you can't. That may be true. I haven't thought about folders in a long time. I know you can't move the whole folder in its.
At least
you should be able to move the whole folder and its contents. So, are you able to? Is the move command blanked out when you try it, or?
No, if I use it, I get the only option is to move around in my own folder in the workspace. So that's why yeah.
Yeah, let me show that. I'm gonna go ahead for everybody and drop out of the slides, the timer slides here, so I can. I think I will anyway. Let's see here. So I can try one or two things with Cdr. Let's do an example with that for starters. So I'll go to my workspace.
Well, at the same time, I could ask Eric, could you see my folder? Because I shared it and also made it open view.
So when I click on, are you able to see my screen?
Yeah, I see. We do, yeah.
So here I see all the things that are below my folder, but I can back up to a higher level. Now I can't see what's in the users folder.
You get server error, so that's what I saw as well. So should I now report an issue?
Yes, please. Yes.
But at least, Eric, could you check whether you are able to see my folder, my workspace, because I made it open view or shareable?
Okay, that's definitely a recent bug. I'm sorry about that. We'll have that fixed by tonight, I hope. And yes, the same is for copying. The same navigation applies. So is there any workaround here?
Oh, it is, of course, as long as we know that we work in our own directory, is no problem. Huh?
Yes, no problem in the moment, but obviously not ideal. And so I just want to try a search. I'm not seeing Dyke either, it looks like. That's interesting. There it is, okay. So Renate, you're try entering just a single term like M4M or DEIC in the search, and you're still not seeing any results, is that correct? Did anyone else, we have about 30 seconds, did anyone else have, yes, the folder we're using is GoFairZone Embed M4M training.
I know, but I created in my own workspace. So the question is it visible for you? Because I did an open share or an open view. I cannot test it myself, right?
Right. Let's check.
The name is in the chat.
Yes. It's possible that it will not be right away because it can take a little bit of time to populate everybody's. So far it is not, but I would not say that that means it won't be accessible.
Okay.
And we'll check that in a bit. So did anyone else have a problem where they couldn't actually find the folders in question?
I guess a lot of people were able to find it because at least in the folder, where I created my folder, there are a lot of extra folders now. So.
Good. We will go ahead and come back together then. You can feel free to keep typing as you want, but we'll start talking. There can be a little bit of a lag between when, let me say it a little differently. The process of populating the permissions is can be a little bit laggy because there are a lot of permissions to populate the database for all the different users. And so either in this case where someone has given permission but we're not seeing it, or in a case where you've just logged in for the first time, say within the last 20 minutes, half hour, it may be that you can't find everything right away. And that's Terry, I'm sorry for the confirmation email problem. As we were mentioning earlier, we definitely have the occasional problem where the confirmation email persistently gets snagged by somebody's email address. What we recommend to people is that they try registering with a different email address that is not as well spam filtered as a means of getting through it. And then later on, we can actually coordinate with you individually. And what we will do actually, Eric, what's the best way to capture open tickets, as it were, from people who are not able to log in or not able to find something. Are we saving the chat in particular?
Yeah, so we actually have a common notes document, a Google Doc.
Okay, okay.
And Micah and Rita are moderating that. And so we can open up a section for tickets on Cdr.
Yeah, maybe just list the tickets by title so that we can then cross-check, and if one isn't in Cdr, we'll add it later.
Okay.
And thank you, Terry. Yeah, experiences on that. Let me go back to my slides to remind me what I'm supposed to be doing. So yeah, I'll just mention before we start talking about that experience and questions people have, that when we do the next Cdr demonstration you got a work for you all, assignment for you all to take on, the focus will be on a little bit on composing different elements. I'll play the video there, but we're not going to do an assignment for that because it's relatively easy and you'll be able to play with it and figure it out, I think. And then the semantics, which is much more interesting and complicated. And we'll actually learn a lot about semantics tomorrow, maybe more than you need to use in your day job. But it helps understand what the value of the FAIR approach to semantics is that we're describing. So we'll learn a little bit of the resource description framework. I promise you'll be able to show off to your friends later your knowledge of current technologies. And so that will be tomorrow's, your tomorrow's project. And so that's it. We found a few people who had a few glitches, it sounds like. Sorry for that, and we'll see if we can take care of them. But what concerns or questions do you all have about using Cdr so far? Any comments or questions that you want to bring up? Not that it's obligatory, just checking.
John, I have one observation I'd like to make.
Yes, please.
Yeah, so, you know, in your video presentations, you were showing that all these metadata components or artifacts that we were creating in Cdr have for themselves some metadata around them. And I just wanted to, I just wanted to kind of reference, you know, that this is something that the data stewards can really take advantage of, in the sense that, you know, you can think of these components as things that you've authored, and, you know, these are then things that are something that, you know, in a way, these are compose a portfolio of your accomplishments here. And I just want to give a sense that, you know, the data stewards are working here in an environment where their stuff could be highly reused, and we would know.
Excellent point. Yes, all of these things that we create, whether we'll talk a little more about the composing tomorrow, but you can create a field for an individual question, or an element, which is a collection of related questions, or a template, which collects the elements and fields together. All of those are artifacts in their own right. They're digital objects that get their own identifier, have their own creation date, modification date, and so you have the ability to not just create those, but share those, as Eric's saying, and use it as the basis for further work over time. So it's really a building block system for creating this kind of information, this kind of form.
Yeah, and in the end, you know, all the artifacts that are produced under the COVID program might even be labeled as such, and would, you know, it'd be easy then to kind of at some point do a search and see that these are all the components that were built in the COVID program, and therefore would be pretty good candidates for the specifications that we would give for, like, the FAIR implementation profile of the COVID program.
Right. I especially appreciated somebody was saying, sorry, I'm looking back for it now, there is the ability to create those things that don't exist yet. That was Petra. That it can develop the things that are missing, and if you do successfully develop something that's useful to you, then making it visible and advertising it in other ways is very helpful for others who might have to develop the same thing. All right. So if there isn't anything else, we'll go to the last major topic here, and we'll take on the issues that we had afterwards. I'll work on it a little bit. Actually, we'll be able to start working on it even as you all are calling it a day. We'll be here taking care of those, and so you can keep an eye out for I guess either it would have to be Slack messages for those of you who are on Slack. We'll look for your name and see if we can connect with you that way if we have your problem fixed. We'll just create a bulletin board tomorrow to announce all the fixed problems. All right. So the last thing that I'm presenting today, except possibly if we have a little time, I'll talk about how Cdr and BioPortal work together. This is about attributes for fair metadata or fair data, and this got a lot of attention in the last training because they were describing a lot of their components of systems and so on, a lot of their measurements. I'm going to give you the light version. We have much less time, and so although these are described as exercises, you won't be exciting the exercises, but maybe you'll get a feel for what we went through. The idea here is to be able to get a little bit of experience to actually create a metadata model and to build the forms that have the right information in them for what you want to maintain. And so you need to think about what attributes you want in your model, of course, and then what the life cycles of those attributes are. Where are they coming into existence? Who's creating them? If you have a person creating an attribute and they only have time to create it once a day, that probably needs to be in a different place than if you have a system that's automatically describing its own data with metadata summaries, and you want to store those and they come in once every hour. So those might end up in different models, even though the actual information is strongly related. So you need to think about those sorts of things, and part of the idea is just for a lot of people, thinking about this in terms of a model is pretty hard, but if you just think about it in terms of making a list and describing things in a list and then creating a template in Cdr, for me anyway, it makes it easier to conceive of the whole problem. So the first task we had was to name the attributes you need for each component, or for each, in our case, with something like a COVID form, it might be for each step in the process. And so the idea was to actually identify some of these attributes, and ideally you'll find attributes that can go into different parts of the model, into different components or into different process steps. So you're describing different things with their own attributes. And partly you're trying to get an idea of what your system's metadata is, and prepare yourself for the fact you're actually going to have to create a form with this in it later. So ideally you have maybe a little bit of hierarchy built in, and if you're working with teammates, it's nice to do that. In that case, there were a lot of components that weren't actually part of a repository. I think for a lot of you, I'm imagining here that the role you have has to do with providing data and metadata to repositories, some kind of data store that other people can access. So a lot of your attributes might actually be about the data store content itself. So in this task of creating the attributes, will go to this spreadsheet and just take a look at it after I walk through these two tasks. The idea was to make the list of using the short names of the attributes, and then keep track of whether there were any that were hard to think about. And the idea was that maybe you can make a quick list of attributes, even if you can't do a detailed one. So we won't be sending you off to work on that right now. Instead, I'll describe the second part of the cycle there, which was to really dig into those attributes. And to dig into them, as I mentioned earlier, you want to think about how often does this attribute change? Does it almost never change, or does it change sometimes, or is it changing every 10 minutes? Who's filling it out? Is it a system? Is it a person? Is it a bunch of people, a team of people? And then very definitional questions. What kind of thing is this in terms of, is it a number, or is it a controlled term or a Boolean? Is it a true false thing? And the thing we're most interested in some ways, are the controlled terms, because that's the value that we add by being semantic. But all of those, understanding whether you'd rather have something be, for example, a true false, or whether you need more answers than that. Maybe you need yes, no, and don't know. And you can't call it a Boolean if there's a don't know in there. So if you need 3 answers, then you would call it a controlled term, perhaps. How do you description it? How would you describe this attribute for a user who's trying to fill it out? And how should they go about filling it out if it isn't completely obvious? I'll just say about the COVID form that you may have looked at, or that we'll work with a little bit more. There are a number of things there where I say, I really don't know how I would fill that out. I could easily imagine different people filling that out in different ways. And so having that kind of detail and contextual information can make a big difference in how useful the information is that's provided. And most interestingly, if you decide, well, this is actually, I would really like there to be a vocabulary for filling this out. Maybe it has to do with how healthy everyone is. And so it would be really great if I could find a question or a vocabulary that's used to describe how healthy everyone is. And so the task of finding that vocabulary, describing it if you can't find it, or naming it if you can, is a really important task in starting to define your model and what's possible with your model. So in the exercise, we spent about 5 minutes to really rigorously define a few terms to see how hard it was, and then just sort of go through a lot of them and get a feel for what we're working with. And what we're mostly looking for in that context is controlled terms that can be used to fill out attributes. That'll be the subject of an exercise tomorrow. I'm gonna just show that spreadsheet if things go well. Yes. And so the template, and this is a spreadsheet, I gave you a link to it so that if you wanted, I believe you should be able to copy it, and you can certainly explore it in more detail. I think you shouldn't be able to modify it, but please don't try. But when you copy it, you can modify your own, of course. And so we had them for each of the different projects fill out this template page. So this was one of the projects called a wind scanner, and so for the various components, you can see there are different attribute names that apply, and these are described over in column H in some cases in some details. The value type is given in column G, whether it's free text or identifier or controlled vocabulary. And what will often be the case the first time around in an exercise like this is you don't have a controlled vocabulary for these terms because you're starting the process of defining your system. And so the part of the exercise and the work is to figure out where to find the controlled vocabularies. We'll talk about this a little bit tomorrow and maybe a little bit in a few minutes. But to really get into details there requires a little more than the time we have for this training. And So as you can see, different projects, their sensors have very different attribute names, and they have, in some cases, very different kinds of sensors. And so this ended up, I think, for the teams that worked on that project, being a really good starting point for filling out that information. So one of the interesting things, let me see if I mentioned this, yeah, cover some of this in the next slide. One of the interesting things about this is that often, if you're creating a form for curating your information, and someone else in the project next door is creating a form for filling out their information, there can be a lot of overlap in the ideas of what you're trying to capture. If you look at the names that you wrote down and the person next door wrote down, the names almost never match. And so it ends up being much harder to agree on names than it does to agree on ideas. So if you ever need to develop sort of a shared specification, the first thing to do is talk about what the things are you're trying to capture. And then the naming is almost secondary. And that's a part of what we see with Cdr as well, that if we can use identifiers to specify fields and roles and so on, it can be much more precise. Excuse me. The other thing we saw was that not many attributes are typically answered using controlled terms at first. When people see that more big controlled terms are available and that they can be very useful in exchanging metadata across projects and understanding each other's metadata, then you start looking for fields that can be answered with controlled terms, and you can often find more, and that can be a useful exercise to actually convert some of the fields that you just had simple strings into much better defined controlled terms. So these are the essential first steps to characterizing metadata in a fair way that has some rigor involved and some interoperability involved. And the controlled terms are really key to that rigor and to understanding each other's work. As I say, the names of the terms tend not to establish understanding in themselves, and are often much more contentious. I recall a presentation from many years ago when I was starting in metadata, and it was from the head of our group called the EPA, Environmental Protection Agency, which when it was created 30 or 40 years ago, was formed out of many other organizations in the US government. And so they had all these existing databases and they wanted to merge them. And they spent a year trying to negotiate how to merge the different databases and agree on what the terms were. And they weren't getting anywhere, and the people finally realized that they needed to stop talking about what the names were to use, because each of their constituencies used names that were very familiar to them and did not want to change their names. So they had to give up on changing the names and instead use just identifiers and the definitions as providing the meaningful relationship between the different concepts. That's what we're doing here. We're using identifiers. And if it's the same identifier, or if it's the identifier that can be determined as the same meaning as this other identifier in some other vocabulary, then you know you have something that is shareable, is interoperable. So that's very valuable. And so the concept gets the identifier, not the name. And that way you also have the ability to change the name or use different languages in different communities. And it isn't so much of an issue. So I'm going to take some questions at this point. And if we don't have too many questions, you still have to stay a little longer because I want to show you how Cdr works with BioPortal, and for that matter with other systems, and maybe give you a quick taste of BioPortal. So we don't have to get to that today. Definitely if you have a name, this is a good, sorry, definitely if you have a question, this is a good time to name your question.
John, there's a question at the bottom of the chat there.
Mm-hmm.
This is from Ditka. I cut and pasted, so her name's not there. Can you see that?
Oh, it's actually from Eric in the chat. Define the metadata attributes.
But it's not my question.
I don't actually see a question there. I just see task 2, define the metadata attributes. Now I see it. Thank you. Yes. So someone, thank you.
Yeah.
Someone pointed out earlier that very correctly, and I should have said this up front. I'm sorry. The videos go very quickly, and and some of them, as I watch them again and again, I realize where there are editing discontinuities that I didn't see the first 3 times. And so first, don't feel bad about not being able to stay up with the videos. That was 99% the creator's problem, which is me. But it is good to be able to go back to them and be able to review them. And I would encourage you to do that, and feel free to skip ahead to the 2 videos that are in tomorrow's presentation. Let me paste in the link that goes, I think that's the playlist. Let me click on it and see. Yes, the playlist that Nia has typed in. I apologies, I'm just taking a guess at everyone's pronunciation. Would love to hear the real pronunciations later. Nia published a playlist that is the set of videos that we have seen and will see. So by going back and just taking one more look at each particular video and then trying it on your own, you'll see if it works. And if it doesn't work, then you can come back and look at the video more, and or send a note through the Slack channel. I'll be monitoring it, and in your daytime, which will come later. No, actually, you are all going to bed now, so that's fine. Yeah, I'll be monitoring it between now and when we start the next session, pretty much. So we should be able to answer any points of confusion for you. And then there is if you have Keynote, if you have a Mac and can look at the Keynote, the presentation will change. I haven't quite finished the ordering of things in the presentation for tomorrow, but most of it is there, so you're welcome to look ahead there. But the playlist and the existing PDF cover today's material. I also talk pretty fast during these presentations sometimes, and I'll try to remember not to do that so much tomorrow. And other questions? How do you know that someone has shared a template folder with you? I see his question. That's a great question. The way you will see it if they have shared it expressly with you is by looking in the Shared With Me tab on the left side. Eric, can you paste in the link to the PDF? It actually is the link to the folder that has both the PDF and the Keynote. So that,
the OSF document, OSF.
Did you move it?
Oh, well, I have it. I have your presentation from today, the OSF.
Yes, yeah. So that would be fine if you want to paste the link to your OSF.
Yeah, absolutely.
Share.
Yeah.
Thank you. So I gave him a link, which you may have seen, that points to my share, but the OSF share is a longer term one, so that would be good. So there's the link to the slides. Thank you, Eric. Anyway, returning to the earlier question, sorry. When someone shares a template or folder explicitly with you, then you see it in your Shared With Me. If they share it with everybody, then you see it in the Shared With Everybody link. And that's the primary way. They can tell you, of course, and can include the long URI so you can access it directly. And that's how we end up doing it a lot, is sort of handing off URIs to each other, IRIs to each other. Any other questions or comments? Let me bring up a different slide deck. Right. So I didn't tell you earlier, but Cdr has a it's a fairly rich system, fairly complex system. There we go. That's the one I wanted. So a simple view of it looks something like this. We've been talking about the template designer is on the left that we've used. The metadata editor is shown in the middle here of this diagram. The resource manager on the right. Everyone uses the resource manager, and then only the modelers use the template designer typically, and the editors are the biggest user of Cdr. All of these systems are built on services in the back end of Cdr that are actually publicly accessible. And so you can design a system that interacts with those services, and we'll come back to that in just a second. Then this whole package that we call Cdr talks to software called BioPortal, which has about 1,000 vocabularies of controlled terms, and they represent largely biomedical science, clinical and medical terms, but also other domains as well, earth science and other research domains. So that's what drives Cdr is those terminologies. And we'll see tomorrow how it works to actually select one of these controlled terminologies. But the point here is that once you've selected it in the template and said, I want everybody to fill out their terms from this particular terminology, maybe even this branch of this terminology, then when they're filling out the form 3 days or 3 years later, they are accessing, the Cdr is accessing the BioPortal software and saying, what's the current set of terms in that terminology or in that branch? It doesn't, we don't save the set of terms, we just save the pointer to the set of terms. And that can often be a live pointer. So as science changes and as the terminologies evolve and mature, then when you ask for, say, an entry that is an animal, then the terminology that includes all the animals gets updated with new animals or renames of animals all the time. And the user who fills it out will get that updated terminology. So that's what we'll actually show you BioPortal in a minute, just to give you a feel for that. And then the submissions can be sent to other repositories, or other repositories can pull them in. The one major case we have of submitting to a public repository is for, I'll call it genetic data, gene samples, where we are sampling tissues and creating sequences. And these get submitted in the United States to National Repository Collection called NCBI. They have repositories called Biosample and Bioproject and SRA. So we have a template that is a very long template because it's meant to be very standard, that can submit data to each of these 3 different repositories as appropriate when the user, as well as the data in that particular case, because those repositories want data. So, so the process can be either that Cdr drives that submission, and those are more details of all the components. We don't need to worry about that now. And let me see if I can quickly get to the examples. Here's an example. This is the workflow that I just described, where we are driving that submission, and the things are turned on their sides a little bit. So first there's the template creation, then the metadata editing, and then the submission of the metadata and the data into the NCBI repository. There's simpler cases, which I won't try to show now, where the repository is actually reaching into Cdr through its API and pulling the metadata out. And so it can be very tightly integrated. People start at that repository's interface. They add their metadata by leaping over to Cdr through single sign-on, and they go back and their system has already pulled the metadata back in and made it available. So both processes are possible, and it's really possible to do just about anything you want by connecting it to Cdr remotely. Most of you don't directly have to think about that, but if you do, or if you know somebody who does, feel free to make the connection for us so we can do that. Now the last thing I want to do, I'll just use 5 minutes or so for this, Eric, and give you time for the wrap. We'll jump to BioPortal. This is the ontology repository I was talking about. If you hear the word ontology and you don't know what it is, if you just think vocabulary in your mind, you're close enough for 95% of the applications that you and Cdr care about. We'll talk a little more about things that get closer to ontologies tomorrow. The BioPortal system, as I mentioned, has close to 1,000 public ontologies. I see all of them, so it actually has about 1,200 ontologies total, but some of those are private or test or whatever. You don't care about them. Someone asked earlier about some of the biomedical concepts, and I can't think of one offhand, but we'll just use their example, melanoma, in this case. So it's now searching through all of those ontologies and saying, who has examples of the term melanoma? And it ranks these in a fair bit of order so that you can see the most likely hits first. We could talk about the ranking another time, and I'll just click on one of those. So that goes into the ontology, and you can see on the left side, much like we showed in Cdr, there's the tree of classes that's in the ontology, the tree of terms. Melanoma being one of those all by itself. That's interesting. And then for that term, all of the details about it. And there are also properties or relationships that many of these ontologies have. We might talk about that a little bit tomorrow as well. And mappings between the terms in this ontology and other ontologies. So it's a fairly sophisticated system, and it can do two things that are not too common with these terms that makes it particularly valuable. One is to, oh, sorry, I'm running a little late. One is to annotate free text by finding terms that match the text in the free text. And the other is to make recommendations about which ontologies are best for annotating or working with your data. So if you have a summary of your data, or better yet, a list of terms that you use all the time in your data, and you want to know what ontologies include those terms, you can plug it into the recommender and either get one or multiple ontologies to cover the space and say, get recommendations. And it goes through all of those ontologies and figures out what the main ones are that are particularly good for those terms. So I'll stop there. I just wanted you to know what's going on behind the scenes when you do something really simple like pick a term in Cdr or tell Cdr to use terms from a controlled vocabulary. But it means that once you've done that, you don't have to, if you've used a good community controlled vocabulary, you don't have to worry anymore about updating it every month or every year as things change. You can count on the maintainers of the vocabulary to change it. Cdr does not assist in annotating data in a direct way, but it does provide the resources that can make it easier to work with some annotations. We could answer that in more detail tomorrow if you want. But So I'll stop there. Eric, let me turn it over to you.
Thank you very much, John. And, we got 2 minutes. So first off, everybody, thank you so much for the first day of this workshop. 4 hours is a long time, and, we just had a couple little breaks in there. Tomorrow, we meet again at 8 o'clock, and maybe we just confirm with Micah or Rita that we have the same Zoom links as today. I assume that's the case.
The Zoom link is in the notes in the agenda. Perfect. I think it's a bit different, but I'm not sure, depending on the password is different. So I think the link as well. So make sure to click the link in the agenda for today's meeting, tomorrow's meeting.
Tomorrow's.
Yeah.
Sorry, so, confusing you.
Well, it's going to be what 7:59 tomorrow morning or 8:01, and you're going to be looking for that link. So
it will be guaranteed.
Yeah, exactly. So it's in the community
chat and Slack.
And yeah, so I hope this was just an exciting look at Cdr. We're going to get more of it tomorrow, and all of this will constitute a kind of introduction to Cdr. And then at the end of tomorrow, we'll take a little bit of time, just a half hour or so, to then kind of regroup and say, well, okay, there's all these ideas around FAIR and the COVID program, and now we've seen this tool, Cdr. How does this relate to the work that we need to do going forward? And we can maybe sharpen the expectations and the program that we set up for ourselves going forward. So that'll be tomorrow. And otherwise, John, I'd like to say thank you for joining us so early in your morning. And I would say also to our participants, I'm very interested in your impressions, and I think John is very interested in the questions. So, if you have something you'd like to share, go ahead and do that in the comment notes. And I will be reviewing it later on tonight anyways. Maybe John can take a look at it during the day, and at least we can kind of record. I would love to know what everybody's perceptions are of what they've heard today.